Aloha, we are convening the House Committee on Finance today on January 12th, 2026 at 1 p.m. for the purposes of our budget briefings. We're joined today by the State Department of Health, and whenever you're ready, you may begin.
Okay. Good afternoon, Chair Todd, Vice Chair Takanouchi, other committee members, the Finance Committee, Chair Takayama and Vice Chair Leroy. Thank you for having us today and the opportunity to present on our budget requests. I am joined here today at the table with First Deputy Val Cato, and then behind me we have, Acting Deputy Director for Behavioral Health, Dr. Courtney Matsu. Right behind me. Deputy Director for Environmental Health, Kathy Ho, and Deputy Director for Health Resources, Public Health, Debbie McFarland. And we have filled the seats with lots of Department of Health staff, so I appreciate their being here in support. Also want to recognize all of our ASO staff who contribute to all the tables and all that work as well. So thanks everybody. Okay. We're in uncertain times. There is such a thing as this World Uncertainty Index, and the spike is the level of uncertainty that has occurred in the past year. And that has been our context in particular. There's been federal policy uncertainty that has impacted the work that we do. And it really began with the nomination or confirmation of Secretary Kennedy. And a lot of this work has involved science and public health, particularly regarding vaccines, but other recommendations. There's just a timeline there of some of the highlights that I pulled from a timeline of the Kaiser Family Foundation. He has made certain claims that have affected the science of what we do. He has claimed acetamin is used during pregnancy is associated with autism. I'd like to share that the evidence indicates it is not. He has made claims that vaccines may be associated with autism. Again, I'd like to reiterate that the evidence indicates that that is not the case. No new evidence has been provided regarding any of these claims that have been made that are on this slide in this past year. With uncertainty has been associated with the decline in trust. This is also from the Kaiser Family Foundation.
An emergency has been reported in this building. Please cease operations and leave the building utilizing the nearest exit or fire exit stairway. Do not use elevators. Repeat, do not use elevators.
All right, go for it.
Oh, yeah.
But that, just in case there are any litigators out there, that is not my recommendation. Like, just do whatever you want, do your thing. All right.
Okay. So this poll compares from January of 2025 to like June of 2023, and you see a decline in trust. People still continue to trust their doctors the most, but even the trust in their own personal doctors decline. And then the circle at the bottom is trust in state and local health officials. And you've seen a steady decline in that. Next slide. This goes into a little more detail about the level of trust. Again, the highest level of trust is in one's personal provider, and that just highlights the importance of having a usual source of care, the value of primary care, and that it seems to be the most trusted source that people go to for information. What's interesting is it's become a political issue, and you can see that, where there only about 54% of people trust their local health department, state health department. And it's interesting to me that 80% of those who identify as Republican trust Secretary Kennedy almost as much as their healthcare provider. So that's a challenge for us, where we are seeking to be trusted by the entire public and all that we serve. And as there's misinformation, disinformation out there, it just becomes an increasing challenge for us to be a trusted source to provide information that the public can rely on. There's also been resource uncertainty from the federal level. Most notable was in March, when there was an abrupt rescission of COVID supplemental funding. That impacted, or would have impacted, 87 filled positions of ours and $9.8 million of federal funding. Basically, we received notification that the funding was no longer available, essentially effective immediately. There's a substantial amount of work done to understand the impact contingency plan. Through litigation and other efforts, there was a preliminary injunction, and eventually those funds remain available. But how we access funds through the federal system, the effort required, the justification required has been a significant additional burden which has continued to this day. There have been other significant reductions in force, and when there was a federal government shutdown, there were additional terminations of federal employees, and particularly at the CDC at one point it was reported that it was down 1/3 of its staffing. Under the lawsuit, some staff have returned, but it's not entirely clear to me at this point what staff have returned, what programs are fully staffed, or what that plan is. There's still a lot of uncertainty. As we are trying to anticipate what the federal funding impact may be going forward, I did review the Senate subcommittee's markup and the House subcommittee's markup of bills that would impact us. The Senate was pretty much flat to 2025, but the House version had some significant reductions. Those items on the right of the screen have been particularly identified as areas that are targeted for decreased funding. And when we look at that information and other information, policy positions that have been communicated from the federal government, essentially we feel all of our federal funding is potentially at risk. But these are the items that we consider to be highest risk because, again, of federal policy positions. And the total of this is about $18 million and 80 staff. We have not been notified that the funding has been cut as of this time. So we do not have in our budget, in the governor's budget, general funds to supplant lost federal funds. But these are the areas that we would identify to be potentially high risk, as you can see when those funding dates run out. And I know you know this, but just to kind of depict it graphically, the continuing resolution continues through January. And what I showed on the previous slide is the federal budget for the current federal fiscal year. Most of our funding is actually from a previous federal fiscal year's appropriation. So we seem to be pretty okay through the rest of this current state fiscal year. The one notable exception, which was impacted in particular during the shutdown, was the WIC funding. And that was another area where we did quite a bit of maneuvering, transferring funds to ensure that the WIC program continued uninterrupted. So there does seem to be WIC funding through the current fiscal year, so I think we're okay. But we're here talking about state fiscal year 27, and it's just really unknown at this time with a lot of potential variation. Once we see what the federal government does, if they pass a bill to impact Health and Human Services through the current fiscal year, that should give us a better sense of where we'll be for the next federal fiscal year. But just to say that we just don't know for sure. Despite all of that uncertainty, I've tried to reassure the department staff that our mission and vision have not changed. Our work has only become more important. Our mission continues to be to protect and promote the physical, psychological, environmental health for the people of Hawaii, and we follow the CDC's model of the essential public health services. I've implemented the strategic framework that we use to inform our decisions and some of our requests. The foundation is really optimizing operations with the 3 core pillars of trust, capability, and effectiveness. And then across is really that overarching departmental strategic public health policy. And I'll go into a little more detail with this. So there's been a prioritize to optimize operations, to change how we work, to really become more efficiently, work more efficiently. One of the things we held this year was Administrative Summit. We had about 250 staff come to really be sure that people understood our policies and procedures and get feedback, see where we need to improve, what we have control over and how we operate. We continue to convert from paper to electronic forms and utilize e-signature. which is particularly beneficial for our neighbor island work, not having to have things be sent here by snail mail. We've also consolidated compliance efforts, including travel requests, UIP requests, ensuring we're complying with Sunshine, HIPAA, and ADA, and also with hearings into a new compliance office. And we've simplified delegated reorganization process. Where we can, we've leveraged technology. We're improving payment processing for P cards, having converted that to an electronic process. We're about to launch an HR portal through which staff can submit like HRD1s, requests to streamline that process, more transparency. There's a new environmental health training platform, and we even piloted a chatbot on our website, which is down right now, but we learned from that experience on how to improve the chatbot, which hopefully, again, to help the public navigate our website and get more information. Within some of the optimizing operations was filling our vacant positions, and I'll talk about recruitment in the next slide, retention. We appreciate the legislature and its work that led to Act 291 and allowed us to do our hiring innovation for rapid employment or hire pilot. Through this pilot, we've hired 38 candidates. It's taken an average of 95 days from when the posting occurs to when the individual starts. So you think of all the steps that have to occur. The posting has to be up, it's got to come down, receive the applications, do the interviews, make an offer, accept the offer, and a start date. All that's occurring in 95 days. And we found that to be very successful. When we contact people, because it is more timely, they've not yet found another job or are still interested in the position. But it's not without its downside. Because in this process, we take all applications before verifying minimum qualifications. That means some applications are received and people are interviewed who don't qualify for the position. So there is, if you want to consider that somewhat wasted work. So 3 individuals who were selected were found not qualified for the position. We also did a number of recruitments where no one was selected for those positions. So that is kind of that waste in the process. We continue to learn and refine. But for the ones that we have hired, we've gotten good feedback. If we look at our overall vacancy rate, it's nearly 30% for the department. For civil service positions across the department, it's 27.6%. You can see how it varies by administration. We have 3,551 positions, of which 3,117 are civil service. 2,373 are filled of our 3,551 total. 2,373 are filled of our 3,117 civil service positions, right, with a 27.6% vacancy rate. We have a higher exempt position vacancy rate. A number of those exempt positions were created for special projects when there was federal funding, and some of those exempt positions are still on the books, even though there's no longer funding. So that's why that rate is higher. So I just encourage you that we're still struggling at about a 27 to 28% vacancy rate. Given our current fiscal situation, I understand people are looking at the vacancy savings. So we, for example, I think last year we had about 33 million in vacancy savings, but that was offset by 22 million in overtime. We had additional costs of contracts, and we did end up lapsing about $8 million from vacancy savings. So just for context, that when we have those vacant positions, we still need to do the work, and that's either done by overtime or contracts, but we did lapse about 8 million vacancy savings. Retention is another priority. We need to keep the ones we have. We had a branch chief summit, so we rely on our division chiefs very much and appreciate their leadership, but we wanted to engage that next level of leadership and also help develop them. So 71 attendees attend that. We've established a multi-sector onboarding program for new employees to get them more engaged, create a cohort, have them feel more connected with the department when they start. Begun some regularly scheduled lunch and learn programs with a variety of topics. We get pretty good turnout actually for more operational type topics, maybe 150 to 200 staff joining for those. We're also trying to support the well-being of our staff, and we don't get as much turnout on those. Okay, talk about trust. The two words that kind of have come up the most for me in this past year are uncertainty and trust. We understand in really this environment, it is essential that we continue to work to earn the public's trust. One of them is community engagement. And I preach that to the staff behind me. We held additional training. We brought a consultant come in and trained 65 managers in community engagement. Community engagement is not us saying, here's what we want to do. We want to engage the community so they can do what we want them to do or we need them to do. Community engagement is that the community feels we can help them with their challenges and their problems. And they invite us feeling that we can help them. And they see us as a trusted source. So that we get invited to the communities. They know we will listen to them. And we will also listen not just to their problems, but to their solutions and see how we can assist. That's where I'd like to go. Building trust also involves communication. We hired a contract, did an assessment of our website, making some improvements. Right now, some cleanup, and then we're going to need to revamp our website quite a bit to make accessing our information more easy. We've increased our social media presence quite a bit. On Instagram, for example, we've increased our followers have increased by about 50%. So now it's at 15,000 in a state of nearly 1.5 million folks. So we would be grateful for you to follow us and amplify some of our messaging so we can get our information out there. Those are all the ways that you can follow us. Our content, it was valuable. We did Hootsuite evaluation, and our performance score is actually pretty good. We can certainly improve, but we need our message to reach people, and we want for your help. We have lots of data. We really try and be transparent, make data available to the public. We have all kinds of dashboards. Granted, it may be difficult to locate some of this on our website, and we'll need to work on that when we do our improvements. But this is an important area for the, again, the public to understand. There's lots of information out there, to inform what we're doing. Okay, as we move into some selected highlights, just by our administration. So for behavioral health, our adult mental health division received 3-year accreditation, so that's a great thing. For children and adolescents, we implemented a new contracting for more of a value-based payment to incentivize staff retention and adherence to evidence-based practice. Also expanded crisis after services, now up to 8 weeks of increased monitoring and as needed linkages to community services. With the opioid settlement money, one of the things we've done was distribute over 40,000 naloxone kits. On the right, again, another one of those public dashboards is how much opioid settlement money we've received and have spent and what we've spent it on. That's all publicly available. Trying to advance the care of individuals with developmental or intellectual disabilities. There's a new training program, and over 100 individuals have been awarded this professional certification as a result of that effort. And another significant project was modernizing our electronic health record. For environmental health, as the debris moved from the temporary site to the permanent site, we were continuing involved in monitoring that, doing air monitoring, and being involved in the closure of the temporary disposal site. We, again, had posted all of our testing online, but the U.S. Army Corps of Engineers, they had done some testing and that data had not been readily available. So we worked out with them that we received their data and we added their data to our website too. So property owners can go onto our website and see the testing the Army Corps did on their property. There's a pilot on Maui about discarding electric vehicle batteries because they're maybe lithium based. You can't transport them off island. So this is a way to kind of deactivate those batteries to be able to transport them to dispose of them on the mainland. Water safety, so this is from an environmental perspective, partnering with the counties, put more signs, more awareness, put a QR code that will go directly to our advisory so people can know if the water is safe or not to go in. Continue our food monitoring, expanded that. Some pesticide testing we've added. DBC, the Deposit Beverage Container Program, recycled more than 500 million containers this past year, and vector response for things such as dengue, malaria, so other conditions that can be transmitted by, let's say, mosquitoes or rats. We respond to those to prevent further spread in suspected cases. Okay, public health. A lot of public health is education and awareness. So these are just two key campaigns. We continue to also advocate for other policy change to reduce the overconsumption of sugar-sweetened beverages, and also to continue to counter tobacco industry's marketing of tobacco products to the youth, and the continued challenges of flavored baby products. Legislature approved the establishment of a viral hepatitis elimination program. We've been going to work on implementing that. We've also modernized our immunization system and electronic disease surveillance system. For the medical cannabis program, they developed and offered continuing medical education to engage providers on how to better incorporate cannabis into the care of their patients. There have been some two notable things at the federal level just on cannabis and hemp. The president had issued an executive order directing the review of the rescheduling of cannabis from Schedule 1 to Schedule 3. The impact of that primarily would be the use of the banking system that currently is not allowed for our dispensaries or those involved in the cannabis system. That's the most significant one. And the others, it would also allow more funding for research. While more states have done more medical cannabis and research is coming out, we are seeing more of the harms of cannabis, but this would allow further research. The other significant change was regarding hemp. When they passed the continuing resolution, a provision was added that would limit intoxicating hemp products beginning November 26 is when it would take effect. Last year, you gave us, I believe, additional funding or support for oral health, excluding our military bases. We are the only state that has 0 community water fluoridation. So we have a particular challenge for oral health among our keiki here in the state. So programs such as this are extremely important. We appreciate your support of them. And then lastly, you gave us funding to support reproductive health and family planning. We have awarded contracts to ensure and support access to services statewide for that. We've also supplied secured a 4-year supply of mifepristone. I'm sure there'd be any disruption at the federal level. Okay, moving on to our budget. So for our top line request, compared to fiscal year 26, our fiscal year 27 supplemental has increased by 10%. Only 1% is general funds. So we're asking for a $16.2 million increase in general funds compared to fiscal year 26. The other significant increase is in really the rest is special funds. We have about a $110 million increase in revolving funds, $35 million requested increase in other special funds. We're not requesting any new positions. One thing to call out between 26 and 27 is the decrease in end funds. That $17 million decrease in end funds was a result of the end of one of those COVID supplemental grants, so it didn't terminate early, just ended. There's also about an $800,000 decrease in our immunization core funding. So that was the decrease in end funding. We have 4 general fund requests, and I'll go into each of these in a little more detail. Okay. The department is responsible for statewide operations of emergency medical services. In this past year, we've deployed a new system to integrate the clinical data across all 911 EMS providers and trauma centers. This allows real-time exchange of information and better patient care. Over 20,000 records have been shared this past year. And what's also particularly key about this is the field providers can get feedback from the hospitals, and that can hopefully help improve patient care. Updated trauma registry across all the hospitals. You can see began publishing quarterly quality indicators and continued our injury prevention efforts, including suicide prevention, water safety, and created a new e-mobility injury surveillance system. Okay, so each county is slightly different in how EMS is managed. For Honolulu County, they operate it and they do their billing and they keep what they bill. Previously, the state paid the county for their services, and then we titrated the amount of money provided to the county to support them. Where eventually the subsidy had stopped, but this $3.5 million was reinstated by statute. So they received $3.5 million per year out of the EMS special fund. For Hawaii County, we contract with the county. It's county operated, but the state does the billing. For Hawaii and Maui, the state contracts with a private provider to provide the ground transportation in those counties and the 911 air response on Maui. You can see the ballpark of the money we spend on those EMS services. It's about $72 million a year. We do have an EMS special fund that I mentioned. We receive this past year $6.5 million from the motor vehicle registration. There's a $5 of each registration gets deposited into the EMS special fund. 1.25 cents of each cigarette is a tax that gets deposited into our special fund as well. We can receive a maximum of 8.8 million, but because the tobacco use has gone down, we received 4.9 million that was deposited. So we had 11.9 million total in the EMS special fund, and that goes in the special fund. As I mentioned, all those services where we do the billing. Last year we collected about $30 million from billing, and the $30 million lapses to the general fund. It does not go into the EMS special fund. Okay, let's go next one. Now within our EMS, because paramedics and EMTs are county employees, by law, if we're contracting for those services, right, it's our understanding, it's been our practice that our contracted EMS and paramedics would be paid comparable to if they were public employees. So when that union negotiates pay raises, we incorporate them into our contracts. Those negotiations usually occur in about the spring, too late in our budget cycle. So we're always kind of playing catch up to incorporate what the actual CBA increase was, and then to factor that into kind of our next year's base. So as we've looked more closely into our budgeting process, we now put in an estimate of the CBA increase to have that, and then we would kind of need to reconcile it the following year. But as we've gotten to this place, we found that we're about $4.5 million short in our base due to those adjustments from the CBAs. We originally asked for $8 million in our budget, and that was to get us onto a calendar year cycle. We have converted from a cost-based contracting to a budget contracting, which made it far more predictable. But in so doing, where we had been on a calendar year cycle, the funding we had available switched us to basically a September to August cycle. So that's the cycle we're on now. So the original ask was to try and close that gap and get us all the way through calendar year 27. But what we need from an appropriation, understanding our fiscal situation, is just to get us through the fiscal year of 27. So again, we've reduced our ask to just fund us through August of 27, and then we only need $4.5 million for that. So we're okay revising our request from the governor's budget from $8 million to $4.5 million for this program. But I'm going to ask for that money back. Okay. Moving on to behavioral health. We have a behavioral health crisis center in Evele. Here's a bunch of data. You can see kind of the columns are at the top, the number of patients that are seen there in green, and then kind of accepted for care in purple. And it's running about 98 to 99% of the people now that come in that they are able to address. Of the people that are brought in, about 74% are walk-ins. 9% are brought in by crisis mobile outreach, 8% from MH1s, 7% are transferred from hospitals or discharged from hospitals. To date, since it opened in March of 2024, about 2/3 of folks that come in get connected with services. And with that population, from my perspective, I think that's been extremely successful. Over 2,000 folks have been connected with some sort of services through that program. And just examples include about 430 who are placed in a stabilization bed, 250 in homeless shelters. Folks are also connected with other community services or family members. So we have found this program to be very successful from our perspective. Okay. Programs such as that are real important to keep people out of the community, and if we keep them out of the justice system, that kind of benefits all and helps reduce strain on the state hospital. When people are potentially arrested for petty misdemeanors, trespassing, and individuals who may have a serious mental illness, if instead of being arrested, those patients can be diverted such as to the Behavioral Health Crisis Center, then we connect them with services rather than arresting them. And if they go down that judicial system path, they may end up in the state hospital. So to the extent that we can divert those folks and working with HPD to do that, that is beneficial. At the state hospital, still coming out of COVID, trying to restore a whole bunch of programming. They have opened this new transition program in May 2025 to really prepare folks prior to release so they're more prepared before releasing to the community, patients. Increased occupational therapy and recreational therapy. You can see kind of some of the activities that those include. By preparing folks through these activities and this therapy, that helps them to be more prepared upon discharge, to be stable once discharged. Okay, that top right graphic is the average monthly census from January 2023 to December 2025. That horizontal line, which keeps getting moved, we are licensed for 292 beds. Our peak census was 391. We are well above the licensures. We've gotten exemptions, so we're allowed to have this volume of patients, but this is a challenge. And this is one of the things that has led to a lot of the overtime is mostly in the state hospital caring for these increased patients. That little red circle is a dip. So we've been actively working to decompress the patients there. We got as low as 358, and we haven't seen that census in about 2.5 years. But then you see that bump up where it continues to increase. Some of the activities we're doing to decompress the hospital is divergent community facilities. So for example, if there's patients on neighbor islands that could go and stay at a neighbor island hospital that has psychiatric beds rather than coming over here, we're trying to do that. We have patients who've been admitted to the state hospital, but as part of the transition, if they're from the neighbor island, they'd be closer to home and family. We have transferred patients to neighbor island hospitals, inpatient hospitals, as part of their process, to get them ready for discharge. We've also discharged 15 patients to intermediate care or skilled nursing facilities. This was something you passed last year to allow that, so we appreciate that, and that has helped with that. We've also looked at transferring patients to the mainland. There's a program there, CRCC, we've had a contract with them for about 10 years. And there was a tragic incident that occurred earlier this year. And we've put a pause on transferring patients there. There's currently 7 patients there. We sent our own staff out to check in on them and ensure that they are safe. And we continue to work with that program as we evaluate our next steps and who might be appropriate to bring home. We also will be looking for additional mainland facilities that might be appropriate, for other patients as warranted. But we have a pause on transferring any patients to the mainland at this time. We have decompressed by 47 patients, but you can see that the census has not decreased by 47. We're starting to see, I'll say, a recompression. The bottom right chart shows at a point in time of the patients at the hospital, the offense that they committed. So as we've gotten more to present, that green line at the top are felony Cs. The percentage of admissions for felony Cs doesn't seem to have increased. What seems to have increased is the length of stay. So we're looking more closely to understand why those length of stays have increased and what we can do about that. The line below that are felony Bs. They have increased as well, where before they were lower than misdemeanors and now they're higher. That orangish line at the most bottom are actually the petty misdemeanors. Petty misdemeanors have the highest number of admissions, but because their length of stays are short, they don't contribute as much to the overall census. They consume a lot of resources just to admit them and discharge them, but you can see that their admission rate has been relatively stable. Okay. This is the total average census for the year from fiscal year 22 to present. You can see how it's increased since 22. It's been a little more stable from 24 to 25. Our payroll has gone up as the census has gone up because we have to care for more patients. In 25, and our payroll includes vacancy savings, and the payroll actual goes to both filled positions and overtime. So in 25, our payroll variances, we were short $6.5 million from payroll, and we just have to move money around to cover that. We're projecting in 26 a variance of about $10.3 million, but 3.7 of that is due to THP. So if we receive that THP money, we'll be back to kind of that baseline of $6.5 million shortfall. And we're projecting, again, similar, about 6.3 million payroll shortfall for next year. So that $3.5 million I was kind of offering up earlier, as we look more closely at these numbers, I'm asking to increase our request from $2.5 million to $6 million to cover this payroll shortfall. Last year, you gave us $5.5 million for contracted beds that we're using for those nursing facility patients. And also for those other psychiatric beds on the neighbor islands, for example. So we're asking to have that $5.5 million recur. So those are the two asks: the $5.5 million for contracted psychiatric beds, and this $2.5 million, which is in the budget, that I'm respectfully asking to be increased to $6 million to cover our payroll shortfall. Okay, I'll try to speed up. Office of Healthcare Assurance. They do the licensing for facilities within the state. A partnership with, let's say, the Medicare program, and they do the licensing of Medicare facilities so those facilities can bill Medicare, and we receive funding from Medicare to do that work. However, we are short about $600,000 of the cost of doing that work from what Medicare actually provides us. We have to do those surveys because if we don't and those facilities aren't licensed, they can't bill Medicare and Medicaid. So we have to do that work. So that's $600,000 that we need to find. They've worked very hard in increasing the licensure processing, and they've decreased from 11 months to 6 months for adult residential care homes. And the total number of care homes is 500 currently, which is the highest level that there's been in a while. So hopefully that's increasing access to long-term care services in the community. In addition to licensing, OCA is responsible for background checks. And the background checks really help protect vulnerable patients in that work. Okay, so these are kind of the current background check requirements and statute. Right now, the cost is passed on to the individual and the employer. So it is, referred to as an unfunded mandate. Since doing the background checks, we've continued to expand the program. Last year, our vendor conducted nearly 10,000 background checks of individuals. Why do we do that? Is because there are people who perhaps shouldn't have direct patient access to vulnerable patients. So in just the last 2 weeks, where they did 722 checks, 10 were found to have disqualifying conditions. Other states have what's called a wrap-back program. And this is kind of an automated daily update where it pings databases. This would greatly improve efficiency. Once you do that initial fingerprint check, which is a national kind of FBI search, all the other databases are state databases. So if there were a way to automate those with state databases, it's all state dollars exchanging hands. But if there's a way to reduce the cost to our healthcare providers, this would be one way to do that. Our understanding is the eCrim database is ready for this and can support that. But to my knowledge, those other databases are not something that can support that. Because background checks are required for certain provider groups, this background check system that we need the funding to implement will make it easier for those long-term care, other such providers to be able to track who needs background checks in those systems. Again, they're still having to pay for it. Our vendor's doing the work. So we need that for that system that is currently in beta testing right now. Okay. This is a hot off-the-press development and is not included in our budget. Keno Highly is about 60 years old, and it has met the end of its kind of use. There are parts of the building we can't even use anymore, where this asbestos-filled ceiling is disintegrating. We actually do air quality testing to ensure it remains a safe environment. The sooner we can get out, the better. And we are today.
I'll say this.
The leases have been agreed to. It's just a matter of getting routing for the signatures. So we'll be moving 66 staff to City Financial Tower, which includes vital records. We'll have that ground floor space that would be readily accessible to the public to get their birth certificates and marriage certificates. We'll also have some space higher up for other staff that don't interact directly with clients. And then at the ASB Tower, we'll have 483 staff moving there. Those are about the time frames for moving in. And we're projecting this cost to be $3 million in lease for next fiscal year that we would need. Okay. All right, special fund request. So the amount column, the total amount at the top is the desired ceiling request. The amount in parentheses is what we think the increase will be. So if you look at the request, and I apologize, some are for the desired amount, some are for the increased amount. So I just want to clarify what outcome we're respectfully requesting. I'll go into this a little more detail. Okay, vaccinations. This is from the CDC website. It's through the 24-25 school year. So these data occurred prior to the current administration taking office. And we're already seeing a decline in vaccination rates, even though it was slightly up from 24-25 compared to the previous year. The trend is down for vaccination rates, and exemptions continue to increase. Next year, we would expect to see the effect of any impact of the current administration. With the decline, we are seeing an increase in vaccine-preventable diseases. We've had one confirmed case of mumps, 2 cases of measles, and we've just been lucky that we've not seen more spread. We've had wastewater testing that is positive for measles, and we have not had confirmation that there are other cases of measles in the community. It could have been a traveler who just still had some residual shedding of virus, so we're not really sure. But we remain at high risk. We're well below herd immunity for measles. Pertussis is just one example where we're seeing a significant increase in pertussis cases. So we continue to be very active in this area. As a result of some of the changes at the federal level, did result in the establishment of the West Coast Health Alliance. This was initially created by California, Oregon, and Washington. Hawaii joined the day following the announcement, so we're kind of a core member of the West Coast Health Alliance. You can see the purpose is really to provide science-based recommendations and guidance that is consistent, let's say across the states, have aligned messaging, and hope to restore or retain trust in the community with these recommendations. We have weekly calls standing, and then we meet when we need to respond to something that recent federal action. We've issued releases on changes in vaccine recommendations and vaccine schedule, and it's been a pleasure to work with these other states. One ask is to increase the ceiling. So to implement Act 175, that gave us the authority for a immunization purchasing program. That authority allows us to bill health plans and use those funds that would go to the special fund, but would need the authority to expend the funds to purchase the vaccine. And then we reconcile with the health plans on what the actual spend was for the vaccines. Because we can purchase vaccines at a cheaper price than the health plans will reimburse, the health plans actually will save money as a result of this. The program also hopefully makes it easier for providers that they don't have to manage the logistics of purchasing their own, potentially have wasted supply. We would provide it as needed to the providers so they can retain it in their office and administer it to their patients as needed. The Vaccine for Children program, I saw that we spent about $20 million last year-ish, and that was the basis to increase our ceiling just about $30 million. VFC covers about 50% of the state. For now, the VFC program continues to operate, and we can purchase through that program. We do get federal funding to do that. So some of this ceiling is in case that program goes away. Massachusetts has negotiated contracts with vaccine manufacturers that will give the same pricing as able to purchase through the CDC. But if we no longer can access the VFC program, we still would have to finance that purchase, even though it would be at a highly discounted amount. So we're requesting for that ceiling increase to expend those funds to purchase vaccine. We respond to environmental emergencies. There's oftentimes a cost. We try to recoup those costs, but that's after the fact. So to increase the ceiling in this special fund will allow us to respond more quickly if needed to have a larger response, environmental response. We're simply requesting to increase the ceiling $250,000. It's currently 1.25, increasing it to $1.5 million, just to give us a little more cushion if we need to respond to environmental emergencies. Beverage container, there's been some attention about the audit, some of the work that we can do to improve the integrity of the program. We're requesting an increase in the ceiling so we could do more program compliance oversight activities, including more audits and other compliance type activities. So the $5 million increase in the ceiling is intended to allow us to implement some of the responses of ours to the auditor's findings. We project that our expenses will get us near that red line is the current ceiling, which is why we're asking for this. Okay. So for cannabis and hemp, there's only one lab in the state that does testing of cannabis that the dispensaries use to ensure it's safe, not contaminated, health test for let's say THC levels. And then for enforcement actions, if there are products that are elsewhere, such as illicit products, might be intoxicating hemp products or other cannabis products that might be framed as hemp. For enforcement activities, we need to test those products and see what they actually are. So this would be a reference lab partnering with UH College of Pharmacy and Hilo to be able to do this testing as a reference laboratory, which is an important, I think, resource to have that in the state to allow us to do this work. So again, we have a special fund just requesting increase the ceiling to be able to start this reference laboratory. All right. Vital Records is probably the place where we interact most directly with the public. It used to be where I used to get the most complaints from legislators on behalf of their constituents who are having delays getting their certificates. I'm grateful to the work of our Vital Records program because I've gotten much fewer complaints, which is great. You can see the number of orders. Last year, over 105,000 orders that are filled. They're very busy. We have, however, an antiquated system. So the success that we've had is a lot of sweat and elbow grease to process these. Our system tells us the date at which the request was submitted. We actually can't track the date that it was filled. There are 5 different databases, and it's just very cumbersome to be able to efficiently monitor these databases and track how we're doing. There are number of requests that if it's not initially cleared, it might get lost in the shuffle because we can't necessarily find it. So we have made significant improvements, but there still are significant limitations and further areas for improvement. We absolutely need to modernize our vital records system. You had increased the funds to get deposited to Vital Statistics Improvement Special Fund. So we're requesting to increase that ceiling to be able to use those funds to modernize our system. We estimate it to be about $5 million to modernize our system. I believe we have about $1 million of federal funds that we can use toward it. If the funding were available to fully fund the modernization, we could do it more quickly. It would probably be less expensive to do it all at once. Understanding the fiscal situation, we would need to do it in phases, so it'll take a longer time if we are leveraging the special funds. Okay, and then we have our revolving loan program. These are significant programs, so for drinking water, this gets a lot of funding to the counties to support their drinking water programs. Last year, over $56 million funded projects throughout our state. And water pollution control revolving fund, I think we also refer to it as the clean water. Again, another $93 million in loans that were done. These are potentially low interest, some might even be forgiveness. So these are very favorable loans to get funding into the counties. On Kauai, for example, we use this funds, about $2 million for this pilot to fund 100 individual cesspool conversions. We continue to look at new technologies and new activities for how we can facilitate cesspool conversions. Also investing in looking at recycled water use. So there's a lot of opportunity here, and we're seeking to increase the ceiling. Okay, CIP request. Okay, first one, Kalapapa settlement. So they're underground storage tanks. They're within 100 yards of the coastline. There's also a federal law that's, because of the nature of the tank, requires secondary containment and interstitial monitoring. Rather than funding that only to be closed later because it's close to the shoreline, we just want to close the tanks. Partnering with the National Park Service for above ground tanks. So this is just to remove the underground storage tanks that we're going to have to do. So this is a priority for us. We're complying with those requirements. Roughly $9.5 million is for a state lab renovation that is much needed. The Waimano Holly Complex, this has electrical challenges that need to be repaired. Walls are cracking, water infiltration. These are just necessary repairs, and the sooner we do it, the less costly it will be. Let's see. We have four health centers throughout the state that all need roofing repair. This $1 million is really just for the assessment of and the design to be able to repair those roofs. Speaking of roofs, our Waimana Ridge has a facility that needs a roof replacement. It's beyond repair. And then we have we appreciate the BNF ad of that $2 million for just addressing deferred maintenance statewide of our facilities. Okay, rural health transformation cooperative agreement. We appreciate the leadership from the governor's office, and they wrote a terrific proposal that received a $180 million award. Really, for the size of our state, we really were disproportionately funded in a positive way, so this was a good outcome. There are 6 general initiatives as part of that proposal. DOH is the lead for one of them, this Rural Infrastructure for Care Access. As we approach this first year, we know we need to get funding out quickly, so we're looking to utilize existing contracts and partnering with other state agencies, particularly University of Hawaii. And an anchor is modernizing our statewide emergency and trauma coordination system. This is really to be an upgrade, both in any facility that hospitals can be better prepared, and then because we have only one level 1 trauma center, so for inter-island transport, how we improve those handoffs and communication. So we're wanting to create a medical communications hub that will integrate air, ground, hospitals, and have really a full integrated system with sharing of clinical data, looking at hospital capabilities and capacity. One of the proposals in this is for rural ambulances, putting in a Starlink capability to those ambulances to improve care in the field, so they can talk to whatever specialists they need to that might perform care or prepare or facilitate redirection to the most appropriate facility. Leveraging that 911 system, wanting to invest in community paramedicine. A lot of calls to the 911 system are not for emergencies. There are a lot of frequent callers. So if we connect them with other resources that would be more appropriate, and that will reduce some of the strain on the 911 system and hopefully connect people with more continuing care. So we're looking to invest in community paramedicine, and we're also looking to invest in community health workers. Again, the UH College of Pharmacy has a program where they partner with pharmacists and CHWs and have them support primary care. So we're wanting to partner with them and invest in that program to get more of that product. And behavioral health also is another area that's of priority. Looking to establish these certified community behavioral health centers, expanding access to community mobile behavioral health services and other telehealth type services for behavioral health. So these are some of the anchor highlights in our initiative as we get started. I covered a lot of content, and I appreciate your indulgence. Just to summarize, these are very uncertain times. Our mission and vision are steadfast to protect and promote the physical, behavioral, environmental health for the people of Hawaii. We continue to provide science-based information, and we will continue to work to earn the trust of the public. We appreciate your thoughtful consideration of our request and all the support that this committee and legislature has given us. So we are available for your questions.
Great, thank you. Before we turn it over to the committee, are you folks going to be seeking any emergency appropriations for this session?
We're not seeking an emergency appropriation.
Not at this meeting. Okay. Members, any questions for the director and his team? Who wants to get started? Yeah, go ahead.
Thanks, Chair. Thanks, Dr. Fink, for being here. I just wanted to get some clarity on the debt ceiling you mentioned, raising that a little bit. And there was one area where it was just like a modest, felt like $100,000, where others, just curious if you could help, and for later to the committee, can you help just provide clarity on what those little bump ups are in raising the debt ceiling for the various funds that you were looking at. There was 4 different areas.
Okay. We it was the emergency response fund, which is requesting an increase of just $250,000. For the vital records system, our current ceiling is about $470,000. We're looking at the revenue that we would receive, so you want to speak to that?
Thank you. So last year we got a bump in the amount of the fees that vital records get. So from $1 it went to $7. And so there'll be an increase in the revenue from fees. And we wanna use that for the new system. So that's why there's a bump from $530,000 to $1 million for the ceiling.
Great. And then I had another question. Well, I'll start with the one that you and I had a side conversation about, which is the rural transformative healthcare grant. And I understand like the 6 different buckets, and you guys are leading one of those initiatives. Just curious, and I know there's gonna be more information coming. From initiation to deployment to actually a working system, what is that anticipated timeline, or is that a little premature at this time?
So where we can leverage existing contracts, so where we have contracts for EMS services, one of the things we would like to do is modernize the ambulance fleet and adding in, as I mentioned, those Starlink capability. We believe we can do that through our existing contracts, so those can occur more quickly. Our general thinking is we would kind of target 1 county each year based on the amount of funding we have and the cost for of ambulances, for example. So we can move more quickly where we can leverage existing contracts, and similarly with UH, where we can do an MOU, it's faster. For some of these other things where we have to do new procurements, it's certainly going to take longer to do that process.
And then we can have a conversation offline on kind of that step. I just wanna make sure we're aligning great, because Hawaii Island would be really great for that Starlink for so many other reasons. And then regarding still within the Rural Infrastructure Healthcare Act, you mentioned establish a Medicom hub to unify all of our county dispatch, and that's under the EMS centers. But earlier in the presentation, you mentioned that gap about ambulance and paying our EMS, we pay at EMS rates, right? Just asking out loud, what is that bargaining unit number? Cause we had another conversation in budget and finance about some of those bargaining units not being included in this. Do you know offhand?
So we now I put in our budget a 6.2% increase due to the CBA. And when I looked at the amount last year, total that was about $4 million.
Okay. Do you know offhand what bargaining unit number those are?
Bargaining unit 9.
9, okay. Thank you. Thank you, Dr. Fink. Thanks, guys. And I will say I had a wonderful time with our aeromedicine working group. We put together a wonderful report, so thank you. Thanks, Chair.
Thank you. And I neglected to mention, we are joined by Chair Takian. Thank you for being here today. Members, additional questions or from the chair or anything? Okay, Rep. Kitagawa.
Thank you. Hi, Director, Department, thank you for being here. I have a couple of questions. So quick follow-up to what Chair Todd had asked about any emergency appropriations. And I know last year you had come in for emergency appropriation for the state hospital, and in last year's budget we had done 16 million last year and then it's 11 million, for this year, it says 1.1 million in your presentation, so I just wanna clarify. But beyond that, you're saying you don't need any more, funding for the state hospitals? Cause I don't see it anywhere in your CIP budget, so I was assuming that it would be similar to last year where it came in as an emergency appropriation. So I just wanna follow up on that.
We are not requesting an emergency appropriation. With regards to the state hospital CIP, we are working closely with DAGS and the Attorney General's office. The request is tied to the legal strategy. So at this time, we are looking to see what fixes to the facility the developer will agree to make. And should there be a point that the state decides we need to pursue it on our own. So I could, happy to talk more with you
Okay.
offline.
But you do still need the 11 million that we had allocated last year.
Yes.
And then another quick question, I know you presented it on your presentation when you talked about the state hospital and about there's currently 7 patients that I think you said are sent to mainland facilities. I'm wondering if you can provide a little more information. I had asked when the Department of Corrections and Rehabilitation came about the cost differential and whether or not it's similar costs if they're here at the state hospital compared to in a mainland facility, and if those 7 are individuals who have longer sentences and that's why they are in the mainland facility, or does it vary?
As we place, we looked at decompression. In general, it costs about $1,000 a day to be in the state hospital. As we put people in the community, we expect it to not cost more than that. So it really should be budget neutral if we can truly decompress the state hospital. But if we backfill those beds, then it's a new cost. So the cost of that mainland contract facility is comparable and perhaps slightly less than the average daily cost to be at the state hospital.
Okay, and then the individuals who are going there, it's just they have longer stays, or is it varying, or?
I may ask, so I'll start. So my understanding is these tended to be more violent type patients that might be were clinically determined to be more appropriate in a different kind of setting. But the intent is to send people to South Carolina is that they are expected to be hospitalized for a long duration.
Okay, great, thank you, Chair.
Just as a quick follow-up, you mentioned being licensed at the state hospital for 291. Does that assume a state hospital that's like fully operational where every space is available, or would that number potentially increase should we complete our renovations and have a fully functioning building? So the 291 that the state hospital is licensed for, that's right? Does that assume that the building is like fully operational and renovated, or would that number go up should it be completely refinished?
Currently, we do see more patients, so
Right.
we have about, I think it's gone up to even 380. And so we've utilized areas and converted those to facilitate patient beds, housing the patients there. So we're able to do that. So you're asking if it's at full capacity?
Or I guess that 291 figure, is that taking into account the issues we have with the building, or is that not relevant, I guess?
The building is currently being fully utilized, so that we had.
Oh, in terms of like actual bed space? Cause there are certain parts that are kind of, not being utilized, right? Due to the
Correct, so some
leaks
patient
and-
rooms, correct, have been closed off due to some of the leakage.
Sure.
But there are other areas that they've converted to patient
Okay, okay.
rooms
Okay.
to facilitate the high census.
I see.
Yeah.
Gotcha.
But there is a consideration that as repairs need to occur to the state hospital,
Mhm.
we may need to clear some units of patients for repairs.
Mhm.
So as we're looking at managing our census and patient movement, that's something we need to be aware of. So there's another building, Goonsburg, that originally we had thought we would treat it like Kino Hale, where it has exceeded its lifespan. But we still need it. And we still need it because we may have to move patients into it, potentially for, repairs in the state hospital. So, there's a lot of moving pieces, but the need for the state hospital repairs continues to have a significant impact.
Emergency has been reported in this building. Please cease operations and leave the building utilizing the nearest exit or fire exit stairway. Do not use elevators. Repeat, do not use elevators. Attention, attention. An emergency has been reported in this building. Please cease operations and leave the building utilizing the nearest exit or fire exit stairway. Do not use elevators. Repeat, do not use elevators. Attention, attention.
I'll just recess for a while.
Reported in this building. Please cease.
Alright, we're reconvening the committee on finance. I'll come up with a better way to word that so I don't get tripped up next time. I think we're good with that answer. We're gonna move on to the next question. Let's go Rep. Caruso, Rep. Morikawa, and then we'll come around this way. Go ahead.
Thank you so much for your work. I really appreciate the complexity of what you're doing. I am really interested in the space between our streets, prisons and jails, and the state hospital. So kind of that middle space where we would see like step down facilities, long-term treatment programs and those kinds of things. And I'm wondering, I had the pleasure of working with Eddie Mercero when he was with the department, and I really appreciated his attention to addressing the question of corrupt providers, and also really doing good work around cherry picking and hotbedding, like the kinds of practices that destabilize patients and kind of deepen crises. I am really focused on this question because we are seeing exactly that kind of crisis play out in our community. So I'm wondering, first, do you have ways to identify or like metrics to evaluate providers so as to prevent cherry picking and hot bedding, like so that to distinguish between providers who are using taxpayer monies prudently and appropriately, and those who are just using cycling patients through for reimbursement. So that's the first question. And then the second question is what kinds of accountability measures do you have, and are you actively kind of looking at providers who are engaging in illegal practices? Like, tell me if you could talk a little bit about both of those things.
So I think you're asking about contract management
Yes.
for adult mental health services.
Yes.
So
And really continuum of care.
okay. So I'll call our AMHD administrator up to talk more about the contract monitoring that the division does.
Hi, I am Gavin Takinaka, I'm the Adult Mental Health Division Administrator. I'm sorry, I didn't catch all of your question.
Sorry, it
I was
was
thinking about a door.
complicated, yeah, unnecessarily complicated. But really, I'm interested in so the practices of cherry picking patients and then hot bedding patients, just cycling them through for the purposes of reimbursement. So that's one category of interest, and then the other category is like actual fraud in that space, which was evident and was prosecuted in my community. So I know that it's an issue, and I'm wondering like how is your department handling those two types of issues in that middle space that I already think is under-resourced?
Understood. So, great question. We have a specialized branch within the Adult Mental Health Division. The acronym for it is PEER, and it stands for Performance Information Evaluation, and of course, blocking on that last one right now with all the acronyms that we do have. They monitor all of our contracts through auditing process. It's a very thorough system, not just checking boxes. They go and conduct actual site visits and really look through the records, ensuring the contracted vendors are adhering to components of the contract as well as anything related to risk management. We do embrace the, as the director mentioned, our accreditation with the CARF folks, where there is that component of compliance and policy risk management. I hope that answers your question.
It answers part of my question. If you could just speak more directly to the practices of cherry picking patients and hot bedding patients, and the extent to which you folks are focused in any way on making sure the providers that we have engaged in the system are actually providing that quality of outcome. So do you evaluate outcomes? Do you look at the extent to which the people who are released from these facilities then just cycle through the same process again?
I see what you're asking. We are going through what's called a rate study, but as part of the rate study, we're a fee-for-service type system right now.
Mm-hmm.
And part of that rate study, we're looking at a value-based component option to it, where we may start implementing a system looking for compliance with reporting on a gradual basis and incrementally increasing the requirement component of what might be reimbursable through value-based system.
That's helpful. I would like to learn more about that work. Maybe we can meet offline.
Yes.
Yeah. Thank you, Chair.
Thank you, Rep. Morikawa.
My question is gonna go back to your environmental health. I saw that you safely cleaned up 13 tons of electric vehicle batteries. Who pays for that?
So right now we used some grant money and we used part of our environmental response fund. And why we thought it was necessary was because, as you know, Matson and other, as you may know, Matson and other shipping companies are not taking our used batteries off island because of the potential for explosion. And so we have stockpiles of these lithium ion batteries throughout our state. And so we have to come up with a solution. And that was that method, we call it the Maui method because it was refined during the Maui wildfires. So that method was used to reduce the amount of batteries.
And there are substantially more electric vehicles and electric battery use everywhere. So do you guys have a plan?
I understand that there are substantially more batteries on island and it could pose a potential risk. So we are looking at piloting more projects like this.
Okay, and then my second question was about that deposit beverage container program. What is the balance in that account now?
I don't have it offhand, but I'm sorry, I'll ask Lene Ichino-Tsubo, who is our branch chief, to come up and speak. She can talk about the fund.
Yeah, because I see a lot of beverage containers not being recycled.
So the current balance is around 74 million. But we have about 55 million encumbered of that. And we anticipate another 2 million for this fiscal year to be expended.
So it's growing?
Yeah, since COVID, we've seen a decrease in redemption rates. And so we are currently working with the counties to establish opportunities to increase the number of redemption centers. So like for example, on the Big Island, we saw a reduction of redemption centers because of labor shortage issues.
Yes.
And so we've been in discussions with the county of Hawaii to see if they'd be willing to go out to bid again for those same locations to kind of see if we can get that interest from the industry to restart redemptions in that area. So we are anticipating an increase in expenditures for FY '27, not just because of that, but also to address the auditor's concerns.
Good to hear.
In addition to, we are currently evaluating our segregated rates and handling fees. So results of that we anticipate getting around April-May timeframe around this year. So that could also affect our expenditures moving forward.
Okay, thank you.
You have something to tag on? No. On that note, does the state currently have any sort of automated deposit cash out machine? I know in certain cities that's a thing already, where you just drop a can in and it cashes you out. We don't have anything like that?
Reverse vending machines. When the program first started, some of our recyclers had invested in reverse vending machines. What they had found at the time was the maintenance costs to upkeep them are difficult because parts are coming from, I don't even think it's stateside, I think it's actually abroad. So they had some difficulty maintaining those machines, and so that's why they decided to go more manual counting.
Okay, thank you. Rep Kush, you had a question?
Yeah, quick one. Switching gears, thanks for coming, appreciate it, and all your work in the EMS field. I feel like this is like has so much less gravity than those issues. And it's the wastewater issues. I know the division, Jonathan Nagato, I worked with him during the interim and his team have they been able to increase staffing? I know we used to have someone on island and that's no longer the case. And so I feel like there was this, in some of the cases I was helping constituents work through, and I've heard from my county counterparts the frustration, and I tried to be the buffer, and the recognition that the short staff and just the overwhelming nature of it is there been any, and not knowing like your whole how your org chart is within that division, like has there been any steps or improvement or possibly technology? There was GIS, lack of GIS seeing eye to eye, there was a bunch of things, so can you speak to that a little bit?
Yeah, so we do recognize that there are staffing shortages on the neighbor islands. We do have difficulty hiring engineers for some of our neighbor islands. Oahu, we also have some problems with staffing engineers on Oahu, but particularly on the neighbor islands, we're having difficulty. We are actively working with members of the legislature through SPEED and others to speed up our process, to look at innovative technologies on cesspools and IWSs, encouraging homeowners to reduce to bring into their to convert cesspools to IWSs. We're looking at our rules. In fact, we just met with some legislators to talk about rulemaking and how we're going to go through rulemaking. Looking at definitions of there was a time where there was an issue with the definition of bedrooms or lack of definition of a bedroom. We're looking at all of those things because we recognize that there is a great need to encourage homeowners to convert their cesspools.
Sure, and it was, and thank you for that, and I just asked that it seemed like there was the intent of legislation in the past, it's the hope of the public, and somewhere in the middle it's being interpreted differently, and that was where the snag was. And so when you do those rule revisions and working with like the speed task force, I ask that you guys consider, is this being wed to process, or are we just or progress? And that's a difficult, somehow in government that gets lost a lot in the middle. The process becomes the most important thing. And it's very frustrating end user, and
I recognize that there may be a disconnect, but that also understanding that we from the Department of Health, we have to protect public health, or we want to protect public health and the environment, right? So how do we do that? By proper rulemaking. And how we intend to do that is actually we intend to go out to the public.
Okay.
And before we go out, I was just explaining this, we want to go out to the public to share our rules with the public and get their input before we go officially out to the public for public comment. Because what I don't want to have happen is that we go out to the public with our public comment, and then there's some great language or technology or something that we didn't think about, and then it comes in through for comments through our rulemaking, and then we have to go back out for public comment. So we want it to be efficient as well.
super. And last follow-up question on that, what do you think a timeline for you guys to achieve those ends?
So we're talking about the rulemaking. I think we had said a year or 6 months we want to go out for public comment right away.
Sure.
So
great.
we're halfway through our rules now. So what we'd like to do is go out, maybe piecemeal, go out to the public so that they can, as we're finishing one section, we can go out to the public so that they can get input. We can make changes while we're moving forward.
Super, thank you, I appreciate it, thank you, Chair.
Alright, thank you. Rep. Alcos?
Director, My question is, vaping in the last 5 years, wondering about the kids and their health. Did you guys do some kind of study and compare to cigarettes? What's happening in the vaping area health wise with the kids?
See that, it's Lola here. Okay. Got the right person for it.
Thank you.
Thank you, I really greatly appreciate the question, Representative Alcos, I'm Lola Irvin. Our vaping rates have held steady for our high school students, and I'm glad you're concerned. Because even 15% to 13% of our high school students vaping is too high. Because that means there are thousands of our high school students who are still vaping. The other thing we've discovered is for those who are regularly using, they're more addicted. What we are doing is we're reaching out with a program called My Life, My Quit. And it is an app now, so there's an app for that. And so it's web-based, but there's also an app and it's phone-based. So our youth who want to quit have a means of accessing the services in various ways. It is youth-based, so we're working with DOE to promote it. And the posters go in the bathrooms because we know that's where a lot of the kids hang out. We have learned from surveys that we were surprised at the high rate of students who said they knew about My Life, My Quit because of posters. So that's why we're again working with the Department of Education to have it posted in their bathrooms. The other thing we're doing is with young adults, we're finding that they have a vape use rate of 22 to 25% in the 18 to 34-year-old group. And that is the age group that started using vapes before we became aware and had an education and cessation program. So we're working on a contract. We are producing ads to reach our young adult population with high vape use rates.
Are they coming, like, you seeing them more at the hospital or they're getting more health problems, they cannot run, they're getting asthma? Like, is cigarette better or is vape way worse,
Thank you for that question. That's a really excellent question. We are seeing, so cigarettes have other issues in terms of the carbon that the students would inhale, that we would inhale. With e-cigarettes, we're learning more and more in terms of there's no quality standards. So just vaping in itself is not good for the young adults and the children. There are higher risk for asthma. The other thing that happens is besides the liquids that they're vaping, which is based on vegetable glycerin, alcohol, flavorants, and nicotine, there's really high concentrations of nicotine. And so there's a real increased risk for addiction and dependency on the nicotine. So mood disorders, disrupts their sleep, disrupts their memory in terms of the brain functioning and being able to absorb what they're learning in classroom. The other thing that's happening is those coils will also degrade. And so when you vape, you're also inhaling the hard metals as the coils degrade. So there are other risks that are coming up. We also know about more increased cardiovascular risk, high blood pressure, hypertension, that kind of stuff, because of vaping. So overall, it's best not to vape.
Thank you. I got one more question. Director, vaccines, the 72 different type of vaccines that was trying to mandate, and now a bill passed that, we're buying out the vaccine. What is your plans on vaccinating with that 72 different type of vaccine to the public?
So we are concerned about the information that's coming from the federal government, especially the Advisory Committee on Immunization Practices. They are not following scientific frameworks for reviewing bodies of evidence. They do not yet have an established evidence recommendation framework that they've agreed upon or published. So some of the changes that have been made have not had accompanied scientific basis. The recent change in the vaccine schedule, which was based on a review of some developed countries, particularly Denmark, which has been noted, are it's not really comparing apples to apples. Denmark has a universal coverage, it has a national health electronic health record, and a very low prevalence of, for example, hepatitis. If you look at other countries that might be more appropriate as peers, we actually have much more similar vaccination schedules. My position of the West Coast Health Alliance is we continue to support the vaccine scheduled by the American Academy of Pediatrics. Again, these are recommendations. We encourage people, if they have questions, to talk to their healthcare providers and make sure if they have questions that they get their questions answered. We do recognize, patients' consent. It is their choice to get vaccinated. We believe the evidence supports that vaccines are safe and effective, and we encourage people to get vaccinated. But again, it's most important that they discuss with their provider and make sure that whatever questions they have get answered.
Are we vaccinating guys today? Like, does people already getting that vaccination, that 72 different type of vaccination today, like kids and adults?
So there has been some statements made about the number of doses, and those it's a little misleading because it also includes every annual flu shot that gets added in there, or we might have a combined measles, mumps, rubella. Does that count as 3 or as 1? So some of those numbers are a little misleading. When we look at the AAP, American Academy of Pediatric Vaccine Schedule, again, we do recommend that those vaccines have decades of experience and data and have really been associated with a decline in these vaccine preventable conditions. And as we've seen very recently with the decline in vaccinations, the U.S. is about to lose its measles elimination status. So I think the evidence is pretty consistent, pretty compelling with the millions of doses over decades of the benefit of vaccination.
Thank you. Last one is, are you guys planning on supporting mandating the vaccine if this bill come around again?
To my knowledge, there's no bill in the administrative package to that effect. I support vaccines being available to those who choose to get vaccinated, and that is a measure that we are pursuing at this time to ensure that vaccines remain covered, consistent with scientific recommendations.
Thank you. Thank you, Chair.
Thank you. Chair, any questions?
I do have,
Yeah, go ahead.
if I may, I just have one question, Director. You mentioned in your presentation about moving Vital Records Office to the City Financial Tower later this year. That involves a lot of walk-in business, like we know, because especially for like marriage license people, they wander into the Capitol sometimes by accident. Are you sure that this building will have enough parking to accommodate all of the public need?
So it is on the first floor. It is near public transportation. It's near the parking lot by the post office, and it's a longer walk to get to kind of the parking in the Capitol area. We did look at it, and looking at the volume and how full our parking lot is in front of Kino Hall, I believe there's enough access nearby.
With regard to obtaining a marriage license, I think most people go to a agent. So they don't come to the Department of Health. You can get a marriage license from agents throughout the state. And so I think that's the majority.
But I think access is really important. So appreciate the question. And I think that's also one of the benefits of modernizing our system is online request. So we really want to leverage technology to reduce the need for in-person exchanges.
Okay, thank you.
Okay, Rep. Lake, go ahead.
Thank you, Director, for being here. Happy New Year to you and your staff. I was just wondering, I know it's going to be a tight budget this year. Have we ever looked at or again, myself as well as some of the body here in finance committee are new or have only been here for a short time. Where does the department believe there may be legislative policy changes or even, rule changes within departments as opposed to increased funding to really reduce costs or improve outcomes?
When we find ourselves in these situations, you tend to need to want to invest in something that you think will get savings, and you wish you had invested earlier. The motivation is, unfortunately, when you're in those situations, don't have the money to invest. Just one example that comes to mind is trying to reduce admissions to the state hospital, and similar to just hospitals. From a medical perspective, if you can improve primary care and you hope you can keep people out of the hospital, it's a better use of your funds. If we can improve our outpatient care and reduce hospital admissions, that will have net savings. But you have to invest in that system to begin with. And that's something that we are trying to work on.
I appreciate the effort, and I think working with the task force and looking at the HER for successful conversions and whatnot for IWS, we found pockets and areas where in a tight year we can sometimes improve those outcomes without additional funds, and I appreciate and I welcome the conversations at least with our office and whatnot. So thank you.
All right, members, additional questions for the department? Rep. Russo, go ahead.
One more quick question. So I'm concerned about implementation of Act 219, which is the ACT measure that we passed last session. And I'm wondering, when we passed that measure, I don't think we incorporated any additional funding. And I'm curious as to whether that is why we aren't really seeing the effects of the rollout, or at least we're not seeing that in our community. Even, HPD doesn't know anything about it, and it's such a severe crisis. Again, what I spoke to earlier, and I think that particular measure would really help us. And I'm wondering if you could kind of speak to what's happening with that legislation.
Yeah. So one part with the MH1s, I think we're reducing some of the strain on the emergency departments by taking those folks to the Behavioral Health Crisis Center. But the Behavioral Health Crisis Center is just that, it's a crisis center, it's not an ongoing care type center. I think there's an opportunity, I think we need to, we are working on and probably need to do a better job on how do we make those connections and handoffs. That's gotten better when we talk about the number of folks who are kind of connected to services and care. So there's an opportunity to do that. When you're looking specifically at an ACT petition, that is something we really are looking at. In that report, those numbers are low to none. So we recognize there's a need that where we have pieces in a sector of care, how do we have a continuum of care, right, with established handoffs and connections. So fully recognize the need for us to do a better job regarding that, and I can tell you we are working on it.
Thank you. Thank you, Chair.
Great. Members, any additional questions? Jonathan? Oh, go ahead. Go ahead.
Yeah, for environmental health. So the and some of these questions were asked earlier, but I'm just gonna follow up a little bit on it. So the bottle recycling fund, do you track if the amount of bottles being produced or consumed, and if we're going backwards on how many is being redeemed? Or is it increasing? Because if it's increasing, my assumption is that the special fund will start shrinking. That's why the question on what is the balance, I think, was kind of important.
So we do track the amount of bottles that are being sold. We do track the amount of bottles that are being redeemed, but there has been a nationwide redemption rates have been decreasing. We know that, like we had mentioned, we are in discussions with some counties to try to by increasing redemption rates, by adding more redemption, another redemption center, because where I think Lene had mentioned that a redemption center had to be closed because of lack of employee personnel. And so, and we know in one instance on Oahu, a redemption center was had to be closed because the lease ran out. So we're trying to figure out ways to increase redemption rates.
Yeah, because in the inception of it, it was just right to get those bottles out of the landfill. Right? That was the purpose of it. I think, and we kind of always knew that at some point it may be it may go the other way, right? So I've always thought that, and I know there's people that actually make money off of this, the mechanism the way it is today. So changing it would be difficult politically and in reality. There are nonprofits that make money off of collecting it and things like that. But wouldn't it make more sense at some point in time to have a plan to just give it to the counties and increase the fee and make no refund and just make it so that they from like what is it, 1.5 cents now or something to administer, I don't know what it is, but and then 5 cents, right, is the deposit.
Yeah, it's 5 cents.
Yeah, and then but just to increase it maybe 2.5, 3 cents or whatever it is, and just say that's the fee, and then just make it convenient to recycle.
We're open to discussing all prospects.
Right, I mean the counties already have recycling, well, City County does, I mean all the other counties don't, but at some point having that discussion, it doesn't have to be done overnight, but have that discussion to make it just more convenient to recycle.
Absolutely, we're interested in discussing it with you if you would like to.
And then Chair,
No, go ahead.
okay, so and then on the CIP request to change the Salapapa underground storage tank, that's a gasoline tank?
It is a gas tank.
Okay, so in 2000, they didn't have to change it out with that deadline back then?
You know what, I'm gonna leave it to the program that owns those USTs.
I'll just come up here, if I get a correction, for the EMTs paramedics, it's primarily BU 10, but also some BU 9. Okay.
Hi, Rafi, I'm Sheena. Diana Felton.
But there was a deadline, right, to have it all taken out by 2000?
Say again?
Take it out by 2000, if they had to be, all the independents had to take it, all the gasoline stations had to take it. Or switch them to like double wall construction or something like that, double wall piping. There was all the requirements to do that and it had to be done by
I'll have to research that for you. We were not required at that time
Okay, so
to
the
do
government
so.
wasn't required, it was just a private?
I'll have to research it further for you.
I'm just wondering why it wasn't done and okay, thank you, that's good. And then I have a question on the cesspool issue real quick. So at some point, we had this discussion before, but being that, and the mandate has been always a problem for me because it's not financially feasible, right, to convert all of the cesspools. We just will not have enough money to help everybody do that, or I don't think the private sector has enough money to do that. So it should be more a thought out process. I still believe that the counties need to come up with a plan as far as what kind of system they're gonna build. It should be take into account Kauai and the Big Island are the two extremes as far as percolation rate, right? What is a very old island, what is very porous. So the amount that is impacting the environment is probably greater on the Big Island than it is on Kauai, just because. That's true, right?
I don't have anything to dispute that at this time.
So it was never looked into from that point of view, as far as the impact from the environment and the type, right?
Yeah, the
It's a very-
geology
right,
of it.
Big Island is very new, it's very porous, right? So I can see it being more problematic. Where Kauai, it's an older island, and I would assume the population rate, and that's why when they do these cesspools, right, they require you to do that to see how much is being seeped into the ground.
I don't know, I wasn't here when the cesspool conversion work group was formed. So I'm not sure, and I can't off the top of my head tell you what the criteria was used in determining the priorities of the cesspool conversion work group. So there are three priorities. First priority, second and third priority. I think
I remember
one
at
was
the time when they
proximity
first
to
did
the
it, you
beach
know, it was
and
based upon the
correct.
information they had at that time and not necessarily a well thought out evaluation of the entire state. It was just they prioritized based upon the information they had at that time when they first came out. And that's what made it problematic also.
Again, I don't have that information in front of me.
We can follow up. Thank you, Chair.
Okay, any final questions? Alright, we're gonna adjourn and give people a little bit of time and aim for around 3:05. Oh, we're not adjourn, recess. And then we'll bring up the Department of Accounting and General Services. Recess. Aloha, we are reconvening the Committee on Finance for budget briefings. We now have the Department of Accounting and General Services. Welcome and please proceed.
Thank you. Aloha, Chair Todd, Vice Chair Takanouchi, members of the Finance Committee. My name is Keith Regan, Comptroller and the Director of the Department of Accounting and General Services. I want to start by wishing you all a very happy new year. I look forward to working with you as we go forward in this supplemental budget process, and hopefully we'll be able to answer any questions that you might have regarding the requests that have made it through the process itself. Chair, again, we just thank you for this opportunity to be before you and the members to be able to speak to some of the things that we've requested. We did submit our written testimony to you all, but we'd also like to provide just an overview of the department, very short overview, as well as some information that provides insight into our operations and highlights that will give you some insight into the challenges that we're facing here at DAGS. In addition to all of that, you have the budget request that we'll go over line by line in that process as well. The DAGS Ohana of more than 850 hardworking team members would like to express our deep appreciation to the committee for your consideration of the requests. Chair, with your permission, I'd like to briefly introduce our leadership team that's here with us today. Thank you. I'd like to start with my Deputy Comptroller, Myo-Ling Silliman. Myo-Ling Silliman has been with me here at DAGS for the last 3 years. She's been an incredible asset to the department. She brings a wealth of experience. I rely on her every single day to help us get through some of the big challenges that we're dealing with at DAGS. And so I'm just very honored and I appreciate her dedication as a public servant and her involvement. So thank you, Myo-Ling, for being part of this team. In addition to Myo-Ling, we've got from our accounting division, representing them is Alan Visitacion. He's the audit branch chief. If you could just please, thanks, Alan. From our audit division, we have Audit Administrator Ron Shigi. From the Office of Information Practices, which is, by the way, an attached agency to DAGS, we have Director Kalata Amarino. Kalata, thanks for being here. From the Archives division, we have Dr. Adam Jansen. From our Office of Enterprise Technology Services, we have Chief Information Officer Christine Sakuda. And then from our Risk Management Office, we have Risk Management Officer Tracy Kitaoka. From our Land Survey Division, we have Reed Surratt, Administrator. From our Public Works Division, we have Administrator Gordon Wood. From our Central Services Division, we have Administrator James Jimmy Kurata. From our State Procurement Office, we have Chief Procurement Officer Bonnie Kahakui. From our Automotive Management Division, we have Administrative Services Assistant Sima Suika Low. From our Neighbor Island District offices, we have our Kauai District Office District Engineer Eric Agena. From our Campaign Spending Commission, we have General Counsel Christy Chang. From our Office of Elections, we have Chief Elections Officer Scott Nago. From the State Foundation on Culture and the Arts, we have Executive Director Karen Ewald. From the King Kamehameha Celebration Committee, we have Executive Director Amy Hammond. From the 911 Board, we have Executive Director Royce Murakami. And from the Hawaii Broadband Office, we have Executive Director Chung Chang. Thank you very much for joining us. From our Controller's Office, we have our Planning and Policy Analyst Tony Benavisi. We have our Administrative Services Office Business Management Officer Miyoki Ng, our Management Analyst Andrew Choi, and other staff that have joined us here today. And from our Personnel Office, we have our Human Resource Officer Daylene Du. And from our Systems and Procedures Office, we have Anna Louie. Chair and members, the team that you see before you here today are incredible leaders who I admire personally, and I admire them immensely. They take tremendous pride in their work and have helped to lead DAGS in its mission to provide critical central services support to our sister departments and the public. There's no doubt in my mind that our ability to serve is reliant on the trust and support that we receive from this body and from the Governor, Governor Green. We wish to express our deepest gratitude for that continued trust in us and the ability to carry out our mission. We're also very grateful to the more than 850 plus DAGS team members throughout the state of Hawaii that are at the heart and soul of DAGS. Mahalo to all of you. DAGS delivers a broad range of services through our primary mission and focus on attaining maximum value for state taxpayers by providing physical, financial, and technical infrastructure support for state departments and agencies, so they may accomplish their missions. We strive to achieve this through the 8 divisions, 7 offices, and 12 attached agencies. Through these resources, DAGS provides support to virtually every department of our state on every island. Demand for our services continues to grow, and we continue to look within our operations for ways to meet those demands with our limited resources. As I'm sure you've heard from other departments, finding the right people with the right skills, willing to accept positions and fill our vacancies is becoming increasingly more challenging. Of our 856 authorized positions, 127 of those are currently vacant. We've made great strides in reducing our vacancies over the past few years, going from a high of 24% vacancy rate in November 2023 to now 15.5% vacancy rate now in November of 2025. We still have much more work to do in this area, but we will continue to increase awareness about employment opportunities within DAGS by taking advantage of workforce development programs such as Hele Imua. I'm sure you're all very familiar with the Hele Imua internship program through the Department of Labor and Industrial Relations. I'd like to specifically thank Senator Dela Cruz for championing that, but most importantly, all the other legislators who stood behind that program and continue to make it a success today. I would encourage you to please continue to fund that program. It is extremely important, not only for our department and other departments, but also for the workforce that's coming up. It's been a godsend for us, and our IT and public works operations have taken full advantage of these internships. What we found though is that no matter how much effort we put into recruitment, whether it be attending the fairs, the employment fairs, whether it be putting out advertisements in social media, or just talking to people in our communities, wages continue to remain a major roadblock for us to attract qualified candidates to accept roles within DAGS. We do, though, appreciate the hard work that DEERD has done to address some of the wage disparities. We support their ongoing efforts to make us competitive with the private sector. But having more focus on those wages and making sure that we're competitive with the private sector is going to be critical if we're going to be able to get these high-level professional positions filled. Another significant challenge on the recruitment front deals with parking. I'm sure all of you have either heard about it or dealt with it personally within your offices here at the Capitol. But the state's limited parking facilities, especially here in the core Capital District, has also impacted recruitment. We have 16 parking garages and lots in the core Capital District. We continue to analyze utilization, and we actually oversell the lots, meaning that if there are 100 stalls available in a lot, we may be issuing stalls for 125 individuals to be able to use that lot, or sometimes even more. So we are overselling by 25 to 30% in a lot of these lots. When I say overselling, I mean assigning to employees. So we're doing our best to try to utilize what we have. But we recognize that this is a big issue for us, because when employees take a job that's paying $60,000 or $65,000 or less in this district, for them to find parking that is reasonable is almost impossible. It's hard to find anything below $100 or $150 that they can, on a monthly basis, that they would be needing to pay for parking in a private parking area, which is typically 5, 10, 15 minutes walk from this location. So we need to find some way of addressing that. We're looking at things like including options for off-site parking. We're looking for off-site parking locations that we can engage with those owners to perhaps do a mid to long-term lease so that we can get some stalls, and then create things like a shuttle service to be able to bring employees from those locations into the core district. We're looking at also when HART is going to be having the rail in this district. It's coming, right? You can see it, right? It's moving along Nimitz and down Moana Boulevard, and it will soon be along Halekawila and very close to the core of the Capital District. Wouldn't it be great if we could somehow have a shuttle service that could shuttle employees coming from EVA and that side of the island to their workplaces here in the central core district. Those are the kind of things that we're looking at and planning for. You won't see it in the supplemental, but you will see it in the biennium budget as we continue to plan for those opportunities that are in front of us. In our roles, it's critical that we find ways to address resource limitations, and our team has diligently been working towards solutions that we believe will have a significant beneficial impact. Take, for instance, the modernization effort of the enterprise financial system or the existing financial management system that's been in place for 55 years. This body has supported us continuously for the past 2 cycles to make sure that we had the proper funding to be able to move forward with that particular project. I would like to just share that we are in active procurement right now as we speak. I can't go into the details on sort of where we are, but I will tell you that we're very excited with what we're seeing. And we're very excited about being able to finally make a selection and then get into contract and move forward with this extremely important project. We transact about 900,000 transactions per year through this 55-year-old system, about $72 billion worth of revenue and expenditures flow through that system. It is shocking to me that it's taken us this long to get here, but I'm very excited with what I'm seeing, and I'm very excited about where we're gonna be heading with this project. It is going to be transformational for the state of Hawaii, and for many of the departments that are coming in here and asking you for support and needing help from a financial and or efficiency standpoint, resource standpoint, this is going to help transform that. So we're very excited about that project. I just wanted to say thank you for believing in us, and thank you for providing us the funding for that. We'll have more to report, Chair, as we get into contract, and we would be happy to share that back with you in the committee. I'd also just like to talk briefly about our Central Services Division. I introduced Jimmy Kurata. Jimmy is an incredible leader who has been just moving forward with all kinds of transformational projects. We recognize that our facilities continue to struggle with deferred maintenance. And maintenance is just something that it's almost impossible for us to keep up with because we simply don't have enough money to go around to be able to support the systems that must be replaced. But through Jimmy's forward thinking and leadership, we're moving forward with a computerized maintenance management system, otherwise known as a CMMS, which is going to allow us to be able to compile all of the information on all of our almost 200 DAGS managed facilities that we have in our portfolio and be able to tell us what exactly our maintenance picture looks like so that we can provide you with a very clear picture of what kind of funding we need on an annual basis to be able to get through some of the all of the deferred maintenance and get to a place where we're doing preventative maintenance so that we're not trying to fix something that is broken immediately. So that is in active procurement right now. We expect to have a system selected in the next 6 to 8 months, and then you will see some pretty amazing results from that system. So we're very excited about that project within our Central Services Division. While we are on the subject of CSD, I also just wanted to mention, this has come up in numerous committee hearings in the past, but automated external defibrillators, otherwise known as AEDs. We took the lead and found some additional funding to be able to secure 110 AED units, including cabinets that are being deployed into DAGS managed facilities throughout the state, not just here in Oahu. Sorry. Recess. Not only here on Oahu, but on all of the neighbor islands. And so we're very excited about that because that means that we are gonna have these life-saving devices in facilities that can be utilized by the public in the event of something tragic if it were to happen. So that is ongoing right now. The units have been ordered, they've been delivered, we have them in our hands, and our Central Services team here on Oahu is going to start installing those, and our neighbor island teams are actually already starting that process of installing the cabinets. We're also very excited that along with the AEDs comes a training component, which is extremely important for the building occupants. We can't train all of the public on it, but we certainly will spend the time to make sure that our building occupants understand how to use these devices so that in the event something were to happen, there will at least be someone there in the building that has that comfort level. All of that was due in part to Jimmy taking the lead, finding the contractor. Oh, and by the way, it's Philips, just so you know, we were able to acquire these services through a company called Philips. They're pretty well known in the realm of these types of devices. And they're providing the units and the training for our people. And they're also maintaining these devices on an annual basis. Because it's one thing to just buy them and install them, but it's another thing to make sure that they work and they're not expired when somebody goes and tries to use it. That would be very bad from a state perspective. So we're very excited about the work that's ongoing there. I also wanted to mention that I know that feminine hygiene products, product dispensers have been a subject of discussion in the past. We are excited to announce that we've also acquired a number of dispensers as well as products that have been delivered to our Oahu office as well as our neighbor island district offices for installation. So in addition to installing the AED cabinets and the units, we're also going to be installing those feminine hygiene dispensers, product dispensers on our neighbor islands in our women's restrooms. So we're very excited about that work, and I wanted to share it with you because I know it comes up from time to time. So I appreciate all of you, that have been involved in those discussions, and I hope, that we'll see some positive impacts from the installation of those units throughout our DAGS managed facilities. I want to also just touch briefly on our automotive management division. I spoke a little bit about parking, but I did want to just mention that the team also has been looking at how to modernize their operations and their parking facilities. If you recall, and you've gone to some of our older facilities, you know that they have the coin-operated parking meters, right? Well, somebody has to physically go out there and dump out, process the coins. It's all secured, it's monitored, but they have to go out there and physically do that. But what we've been doing now is changing out all of those as much as we can, old style parking meters and installing kiosks, which allows us to just electronically, you can use a credit card, you've all been there and done that, right? You select how many hours, use your credit card, prints out a receipt, put it in your windshield, and you're good to go for the next 2-4 hours or whatever you've selected. And so we felt that, other people are doing it, why aren't we doing it? And so to the credit of our team at Automotive Management Division, they've been very quickly knocking all of those out. So we have very few parking lots now that have those coin-operated units. In addition to that, they've also been pushing forward on installing EV charging stations throughout our garages
An
here.
emergency has been reported in this building.
We're gonna recess
Please
briefly.
cease operations and leave the building.
Sorry, I didn't get my heads up. Okay, go ahead, reconvene.
Sorry about that inconvenience, Chair.
Do your thing.
But our automotive management division has been making great strides in terms of installing EV charging stations and upgrading infrastructure in our various parking garages and our lots. In fact, to date, they've installed 68 charging stations throughout the state of Hawaii, and 48 of those were actually installed over the last year. So that's a huge leap in terms of being able to charge vehicles within state facilities. We anticipate that over the next few years, there will be 195 more EV charging stations installed throughout the entire state of Hawaii in our DAGS managed parking facilities. So we're very excited about that. We appreciate your continued support in those efforts. In fact, part of the request that we have before you, and we'll talk about it a little bit later, is to increase the ceiling for automotive management division so that we can access some of the monies that we've collected. These are non-general fund monies to be able to expand some of that, the need for those EV stations throughout the state of Hawaii. I'd also like to mention that they've also been making great strides on updating our fleet. We have about 403 vehicles in our DAGS managed fleet. And within that DAGS managed fleet, About 4% of those vehicles are zero emission vehicles. Another 4% are plug-in hybrid vehicles. And then about 22% are what we call hybrid vehicles, so they're not plug-in, they're just hybrid vehicles, so you get greater gas mileage. And then the balance, or about 70% or 283 vehicles, are internal combustion engines. And we're trying to move away from the internal combustion engines so that we can be in alignment with what the state's goals are for sustainability. We are doing our best to move in that direction. The biggest challenge for us, though, is around potential bidders coming to the forefront and actually submitting bids when we put out an RFP looking for replacement vehicles for zero emission and or plug-in hybrid vehicles. It's still difficult for us to get people to bid on our stuff, but we are trying to break down whatever barriers might be out there to potential car dealerships from participating here locally. And so we won't give up on that, but I just wanted to let you know that has been part of the challenge for us, is being able to find people to bid on those types of RFPs that we put out. To date, just so you're aware, through our efforts, we have been able to divert about 2,200 tons of carbon emissions through the ZEV plug-in hybrid vehicles and hybrid vehicles that we have in our fleet, and more work to come. And finally, I just wanted to touch on some of the CIP projects that were underway. I'm not going to go into a lot of detail on these, but you're very familiar with them, including the new Aloha Stadium Entertainment District, the Wahiawa Judiciary and Civic Center project, the Kahului Civic Center, as well as the Oahu Community Correctional Center are just a few that are in our portfolio. We have others too that we can talk about if you have questions. But the work is being done by a very small group of people within Public Works Division. We've got 78 of 99 authorized positions that are working on these projects. And just to give you some perspective, out of all of the work that I've just talked about, they have 474 projects that are in their portfolio right now in different stages, whether it be planning, design, or construction, totaling more than $2 billion. So if you can imagine that, it's like having our own engineering and construction firm working for the state of Hawaii with very limited resources and a huge portfolio of work. So these guys are doing an amazing job, thanks to Gordon Wood and his team at Public Works Division. They have been incredibly responsive, even willing to take on projects that are assigned to us that are not necessarily on our radar. I'll give you two examples. One is King Kamehameha III Elementary School in Lahaina. We've been asked to take the lead and help the Department of Education in concert. We're partnering with them on this, but to help them with that project. That was not something that was on our radar, but it's something that we're helping out with. And in addition to that is the Hawaii Convention Center's rooftop replacement project. So two major projects for the state of Hawaii that are not calculated in the $2 billion figure that I threw out there for you to just understand how hard these guys are working on a daily basis. So we're just very proud of the work that they're doing. There's a lot more to share. As I've touched barely on the surface of the good work that our people and our department are doing on a daily basis. But given the limitation of time, I'm sure that you also have many questions about our DAGS operations and as well as our attached agencies that are here. But I'd like to at this time move into our supplemental budget request if we can really quickly.
Go for it.
So Chair, thank you. So in our supplemental budget request, it's fairly lean. We've got 14 requests that are before you today in our supplemental budget request. Of the $217.2 million in requests, 212 approximately $1 million of that is actually ceiling increases. $211 million of that is attributed to our risk management revolving fund ceiling increase. We're asking for your support in that request because we are receiving proceeds from our insurance carriers for the losses that we incurred on the West Maui tragedy that happened back in August 2023. So we have, I think, about $125 million that has been received to date from our carriers, and we anticipate that we will receive probably to the tune of about 200, our policy is 200 million, so we expect that we're gonna probably reach that limit on our policy. As we work with the carriers, we'll have a better idea of how long it's gonna take for us to get there. But we definitely believe that we'll have access to those funds. But in order for us to be able to expend the funds, we need the ceiling. And so this is not a general fund request, it is merely a request to access the proceeds that have come in through insurance proceeds that we can go ahead and move forward and utilize for things like building the new King Kamehameha III Elementary School as an example, or at least providing some of those funds to be able to support that effort. So we humbly ask for you to support that in our request, and we can answer as many questions as you have. We have our risk manager who's here with us, as well as our public works manager who's been administrator who's been deeply involved with that project along with me as well. Our second request is a very simple trade-off transfer of a contracts assistant position that was underutilized and not filled within the Public Works Division. And we're asking that you please allow us to do this trade-off transfer that will place that new position in our Human Resources Office. We are woefully understaffed in our Human Resources Office. Daleen Liu, who's here, who's our administrator, can speak to that. But with our 850 plus employees, we have a tremendous amount of work being handled by, 9 people? It's a small, 8 or 9 people. It is a small team. It's actually probably less than that. But we need these positions, we need this particular position because it's gonna help us get through some of the recruitment challenges that we have, as well as just the overall need for the department. So I humbly ask for your support. We're asking for that position to be moved over. Our third and fourth requests are actually converting a temporary position within ETS, position from temporary to permanent within ETS, and making this position permanent is going to allow us to support the Access Hawaii Committee and other related duties that the position carries. Our CIO is here, she can speak to that in more details if you have questions about it. But again, we're just asking for you to convert this from temporary to permanent. It'll allow us to recruit somebody who's gonna be willing to stay with us and not have them worry about it being temporary and possibly be out of a job because it's temporary in nature. This work's not going away. This work is fairly permanent in nature. So we feel like it's time now to please consider making this a permanent position for the department. Our fifth and eighth requests relate to the increase in utility costs for Oahu, Hawaii Island, Kauai, and Maui. We're requesting for $520,000 for the island of Oahu, $225,000 for Hawaii Island, $80,000 for Kauai, and $240,000 for Maui. I'll just say that if you were to look at what our utility costs entail, yes, electricity costs are going up. But what's really driving our utility costs are actually water and sewer. So those fees are controlled by the counties, the respective counties that we utilize those services from within. And their fees are going up to their users. And so as such, because we have so many facilities throughout the entire state, our utility costs are inevitably going up as well. So we're asking to cover those additional costs. I know we've been before you in the past to ask for utilities. Unfortunately, this is just the nature of this environment, and we simply just don't have the funds internally to be able to cover those costs. So we're asking for your continued support in that effort. That's not to say we're not looking for ways to conserve. We're always looking for ways to conserve. In fact, Jimmy and his team at Central Services, as well as the neighbor island offices, have been actively going after a lot of the irrigation systems to try to identify potential leaks. Because obviously if there's a leak, it's leaking water, and the way that sewer charges are calculated, it's based on water usage. It's not based on how much flow goes into the wastewater system. So they're actively looking at that and trying to make sure that we're not the cause, right, knowingly the cause of some of those increases in water utilization. I will tell you that looking at the numbers right now, we're halfway through the fiscal year, and I would say we're about half of what we've spent in the prior fiscal year, but we have not even come into the hot months yet. So as we come into the summer months, getting closer to the end of the fiscal year, that's when you're gonna see a lot of those costs ramp up, especially water utilization as it relates to the lawns that we have in our large facilities. That's just unfortunately how it is. So we'd ask for your support in that effort. Switching gears to AMD, I spoke a little bit about that. We're asking for the 1.3 million increase in the motor pool revolving fund, which is gonna help us cover the cost of the EV charging stations and the infrastructure that's needed to make sure that we can have those charging stations installed, as well as a $500,000 ceiling increase for the parking control revolving fund. And those funds are gonna be used for the growing maintenance needs that we have in our facility. So in addition to the infrastructure for the EVs, we also have other infrastructure needs, like the gates that are going up and down, that periodically fail, like the lighting systems and the security systems. All those things that go into a parking garage that we don't really think about, they also need to be cared for. And so this ceiling increase will allow us to address those, that ongoing deferred maintenance that's occurring within those facilities. Our 11th request is the State Building Code Council. You may be thinking, why are you guys asking for the State Building Code Council positions and funding for operations? Well, yes, they are an administratively attached agency, and the comptroller sits on the State Building Code Council as a, just so you're aware, a non-voting member. So I have no vote or say essentially in the decision-making of the process, but typically we assign our Public Works Division to represent the comptroller because they have a wealth of knowledge on the state building codes, international building code, the plumbing code, electrical code, all those things that goes into this process. And so they typically sit on that, but by statute, if you look at the statute requires an executive director. It says shall, by the way, an executive director and associated staff. The state has never, has not funded that yet. And so we are asking for your consideration. The governor sees this as a very important operation and need for the state. And so he put that in there through our request and our support. We're asking for an executive director, we're asking for support staff, and we're also asking for some operational money. So in the event they have to fly to the neighbor islands to meet with the county councils and or the administration, of the various counties regarding updates to the state building code, they can do so. So this is a really important positions for the department. Even though it's administratively attached, you wouldn't typically see a department director coming in and advocating for it. But I really feel like this is something we need to do if we're gonna be serious about trying to have uniformity throughout the state of Hawaii as it relates to our building codes. So again, ask you for your support in that effort. Our 12th request is SFCA, the State Foundation on the Culture and Arts. SFCA is here. Karen Ewald, the executive director, she can speak to the $2.3 million request. It's a ceiling increase for their commission works of art ceiling so that they can go ahead and do the great work that SFCA continues to do throughout the entire state. So she can answer any questions that you might have about that. And our 13th request relates to the establishment of a special projects branch within the Public Works Division. We're asking for 3 new positions. We're asking for some operating expenses of about $728,000 for that new special project branch. And you may be wondering, what is that all about? Why do you need this special project branch? Why is it so critical? And I will say that as we move forward with a lot of the more complex and challenging CIP projects that are coming before DAGS, OCCC, the New Aloha Stadium Entertainment District, there are others that are in the wings. I'll give you a good example of one that I see coming forward, and that's gonna be when we look at what we're gonna do with the renovation work here at this Capitol building, as well as what we're gonna do with the Kinauhale property right across the street. You just got an update from Director Fink about leaving Kinauhale, and there's a reason for that. You heard the reason. We believe that that property is ripe for redevelopment, but funding something like that, of that magnitude, is something that we're gonna have to look to other probably sources and ways to fund that and incorporate it with the bigger picture of the renovation work that we need to do here in the state capitol. So these projects are becoming more and more complex. It's not your traditional brick and mortar projects, right, that we're all used to. In fact, it's the funding piece, it's that P3 piece, right, the public-private partnership piece, that we need to have the skill set in and on our team that doesn't exist right now. And that's what this special project branch aims to do, is to bring on board the right people with the right skill sets that we don't have right now. We're essentially contracting for this work, right? We want them in-house. We want them to be our people in-house, being able to guide us through these complex projects. That doesn't mean we're not gonna have to have outside expertise. We're still gonna needs some expertise, but to have it internally leading us, helping to guide us, making sure we're making the right decisions is going to be critical if we're gonna continue down this path of exploring these P3s and these complex projects. So our Public Works Division, our leader, our administrator is here to talk in more detail about that if you've got questions. Our 14th and final non-CIP request is actually for one of our newest administratively attached agencies within DAGS, and that is the Hawaii Broadband Office. Hawaii Broadband Office, as I mentioned, is administratively attached to us, but when they came over from DBED in the prior fiscal year, in the biennium budget, unfortunately, the salaries were not set at the level that the positions were being paid at. And so we're just asking to provide some additional funding so that their salaries are being covered. And I'm gonna throw out one more thing, and it's not in this request, but it sort of was in our initial request. And that was, if you can please, find it in your hearts to put them into their own program ID and not in the comptroller's program ID of 901. It's not to say that we don't love Chung and his team, we do, but we believe that they should stand on their own as their own prog ID. There's actually a program ID that's been set up for them, it's 895. And we would just humbly ask for your consideration, putting them into the proper prog ID so that they're not in the comptroller's office. So I ask for your support in that effort. And the final thing that I wanna talk about is our CIP, and we'll go through that relatively quick because there's actually not very much that's before you. We did have our requests that went in, but what came out of it, and we understand there's obviously there's funding challenges we can live with, and we can operate and we can support our operations. We've got 3 CIPs that you have before you. The total request is 32.5 million, and a majority of that is going towards our lump sum maintenance, which consists of about $30.5 million. You're all familiar with lump sum. We use it to work through the deferred maintenance list. It's very critical for us to have access to that. We've got a listing of what those projects look like. What I will say is this, typically we ask for $20 million. That's pretty typical for us on a normal year. This year it's 10.5 because Budget and Finance actually converted some cash lump sum CIP of 10.5 million into, and they pushed it forward into this fiscal year, converted it into bond. So it is not, we're not like getting extra money, it's just that that $10.5 million that was scheduled for those projects will be programmed into this fiscal year 27 budget request. So we would ask for your support in that effort. It's gonna be extremely important for us. And then the additional $2 million that's in the request is for our Hawaii Wireless Interoperability Network, otherwise known as HIWIN. For those of you that are familiar with it, it allows us to communicate in crisis when other systems are knocked out because of hurricanes or other natural disasters that might make it difficult for communications, typical normal communications to occur. So that we can make sure that we can access and communicate with our neighbor islands and our law enforcement, first responders throughout the state of Hawaii. That responsibility lies with our enterprise technology services under our CIO. She's been doing a great job moving forward with those projects. Our Public Works Division supports that as well. But it's important, we need to make these investments because you just never know when something's gonna happen, and we don't wanna have a system that fails because we didn't put money into it to make sure that we can upgrade the facilities, the towers, the equipment, those kind of things that are important for us. So Chair, I know I've talked a lot and I apologize, but it was a lot of important things that we needed to share with you in the committee today. We look forward to any questions that you might have. I literally have touched the surface of what our team is doing and what we're working on. So we'd love to take any questions that you have for any of the divisions or attached agencies that are here. And I sincerely look forward to working with you in this new year and working with your committee. Mahalo, Chair.
Thank you. I have a brief one regarding the special project branch. And I guess, so at the moment, we have this big project, right, the NASED project, stadium project. Would they be, if we establish this, would they be 100% dedicated there until that's completed, or like how does that look?
Right now, that's the goal, and primarily because that's the one project that's actually moving forward, right? OCCC it is moving forward, but it's not in construction.
Sure.
So I think I should say this, a majority of their time would be spent on NASET. Right now, the people that are spending their time on NASET are my administrator, myself, some of his staff. And so we're splitting our time amongst, all of the other stuff. So what this will do, Chair, is allow that group to laser focus in on that particular project, since it's the biggest one and would be the biggest one on their plate.
Okay, got you. Members, questions? Yep, Rip, go ahead.
Hi, Comptroller, and thank you all for being here. I have a couple of questions. So the first one is about the state hospital. I asked the Department of Health previously a little bit about it because they're not asking for additional funding beyond what we allocated last year, which was the 16 million and the 11 million. So I'm just wondering what updates you might have as far as the work that's being done. Has funds from last year, 16 million, started to be expended as far as fixing a lot of the defects? I know you can't tell us that much about what's happening right now. And so I'm just wondering what information you can give and what updates you can give regarding the state hospital.
Thank you very much, Representative. I appreciate that. I'm gonna actually ask my administrator from Public Works Division to provide you some insight. But I do appreciate you understanding that because there are some other actions that are taking place related to the project, we're limited in what we can share and say about it. So, but I will allow him to share what he can.
And I will share what I can, and that is that I just got a message saying that if questions come up about the Hawaii State Hospital, I should refer to the Attorney General. And that is a text from the Attorney General,
So my sincere apologies.
But can you tell me if you've started using the 16 million that we gave as far as work?
We have started getting that into the pipeline to get the work done. It's in the process of being allotted right now so that we can put it into contracts and expend it.
And I know we've already had this conversation numerous times as we visited the state hospital, but I am very concerned about the amount of money that the state has now put in additionally beyond the end of what we thought was the completed project, right? I mean, millions and millions of dollars. And so, it's really critical. I know the Attorney General is working on it, you're working on it, Department of Health is working on it, but this is, I think, something that requires everyone's collaboration and focus because it is just gonna continue to suck money from the state when we just don't have the money. So I know you can't share that much, but I just wanted to make sure that you're aware that I still feel very strongly about the amount of money that we are putting into the state hospital.
I'll just say we appreciate that and we feel the same way. You should know that we feel the same way.
Great. Okay, one more question.
Yeah, go ahead.
So you had mentioned, Comptroller, about the convention center.
Yes.
And I know that's with DBED. But you had mentioned that you are now involved with the roof project. Can you provide me a little bit more information about what your involvement is? As far as when did you get involved? Were you a part of the contracting process? What is your role?
So our team actually has been involved in that process. Think of us as consultants. We're providing them guidance, providing them input on how we would typically handle our CIP projects. Since they're actually the ones, leading that effort on that particular project, they actually reached out and asked for our assistance. And to which I asked Gordon if he could assign someone from his team and or other members of his team to be able to help and support the project. And so we've been involved now for probably 8 months.
Something along that.
8 to 12 months now. We've been involved in supporting those efforts.
Supporting meaning you've seen the contracts, you helped approve the contracts? Okay, so I would bring this up.
We didn't approve the contracts, but we've looked at them.
Yes.
Okay, so I just wanna, and I'll bring this up again when TBED comes, but their roof project is way over budget. The funding we gave them last year, 36 million, was not meant for the roof project. It was meant for all of these other things that they consider critical needs and critical fixes. They've moved that money to the roof project without the legislature's knowledge or approval. So I'm a little concerned that you, as DAGS, were also a part of that and that there was no communication with the legislature. And
Chair, if I can, or
Yeah.
just to be clear, in terms of the funding and where the funding's coming from for the project, we were not part of that decision-making process. So I just wanna be very clear about, from a funding perspective, I would just encourage you to talk to DBED and or Hawaii Tourism Authority to get their perspective on that, because I really can't speak to that. I did not guide or direct or, ask them to move funds from other projects. If I can just briefly talk a little bit about sort of what was expected and what came out from the offers that were presented to us. And I will say this, that there's a lot of things changed from the time that they came in and asked for the funding initially for that rooftop project, including what's been going on with the tariffs, including with what's going on with the actual damage within the rooftop itself, and the necessary work that's gonna go, and the risk involved in the rooftop project itself. No one really knows exactly what is underneath that waterproof membrane until they pull off all the membrane. We think we have, I'm saying we, the state convention center thinks that they have a pretty good idea of what it looks like underneath there, but no one will know until they actually get in and see that base layer that exists within there. In addition to that, there's a lot of risk involved in meeting the timeline that has been set forth on the project. I think the timeline is like 2 years or something like that, or 18 months, I can't remember exactly, I'm sorry, I don't have the exact number. But it is a very, very tight timeline for the complexity of the project. If you've been to the convention center, they need to move a crane into there. I don't know exactly how they're gonna get that crane in there, but somehow it's situated between the condominium project, the condominiums that are there, and the convention center. And you know that the Alawai is like literally on the back of the convention center. And so they're gonna have to masterfully place a massive crane in there to be able to bring supplies up to the roof deck and to be able to manage that project. And so there's so many more complexities that I think caused the bids to increase over what was initially expected. And so it's just unfortunate, but the work needs to get done. I know that there's talk about, the canopy system is driving up some of the costs. Having worked, just full disclosure, I worked for the Hawaii Tourism Authority for about 2.5 years as their chief administrative officer. Maybe I should have taken the water that you offered me earlier, Chair. But I will say that even having worked on that project back then, we knew there was risk involved in this project. The canopy, what I think is interesting about the canopy, which I think adds like $16 million to the overall cost, is that canopy system now allows the rooftop to be used whenever the center is open. Meaning it could be boiling hot sun, which nowadays, like if you did it today in the boiling hot sun, you couldn't have people out there. The wind would knock everything over, or the sun would like scorch everybody that's on the roof, if you've ever been out there on a sunny day. But now with the canopy system, that $16 million investment is actually gonna allow that rooftop to be fully utilized every time that center is open. In addition to that, what people I don't think are hearing is that when they do book the rooftop for events like at night and stuff like that, they have to reserve the ballrooms that are across from the rooftop. So you know those big ballrooms? They have to block them out, so they can't be utilized. They can't have any functions in there, because if it rains, they gotta move everybody into the ballroom. They have to have a contingency, so they have to basically block off those ballrooms, and so they can't sell the ballrooms. But what this does now is it allows the convention center to fully book the rooftop any time of the day, any time of the night, and not have to worry about reserving and blocking off those two big ballrooms that could be used for generating revenue and bringing in large events at the
Well,
same time.
and thank you for that. I mean, I met with the convention center, I've talked to them about it. My whole thing is, if you don't have the money, you just can't do it. The state doesn't have the money. I mean, right now, we're in a critical financial situation here, and the assumption that money would be available for something that wasn't budgeted for is a concern that now makes us think, what are we gonna do? What are we not gonna fund for someone else,
Sure, I
right?
understand.
And so I think that is a concern, but my also concern is, and I hope that DAGS, as you're involved in it, is I have heard, and I don't know how true this is, that even with this money that has gone into it, millions and millions of dollars, it may not fix all the leaking. There may still end up being leaking in certain parts of that convention center, which is a concern. And so I would just like to flag that for you, that that is what we have been hearing, that it, just because the rooftop is gonna be fixed, that doesn't mean that all the leaking and is gonna be fixed for the convention center. And so I wanna make sure that as DAGS, you guys are aware that that is our expectation. That with all of this millions that's been going into the convention center, that the leaking will be fixed after this closure and renovation process. So I'm not sure how involved you're gonna be, but I would hope that you are managing that, monitoring that, making sure that at least the leaking is gonna be fixed and we're not gonna have to shut down various rooms in the convention center. So, I mean, thank you for that. I know it's not directly you guys. I will bring it up with TVED and the convention center, but I just hope that you will have a little more, have oversight to make sure that the project is completed to the standard.
Yes, Chair Kitagawa, you can rest assured that we will be involved.
If only you guys had a branch to do with special projects, maybe this could have been avoided. I'll leave it with that next time. Okay, that was great. Okay, Rep. Takeuchi, Vice Chair, questions?
Yes, actually, I did have a question about the special projects branch request. So, does it have these dedicated positions for the big projects, right, the first thing you said, plus the others that you kind of mentioned that we've all been kind of talking about whether they're gonna happen or not? So what kind of, these three positions, so what kind of people are we looking at hiring, like specifically, like, are these architects, are these just project management positions? What are these positions gonna be like, and what are they gonna oversee specifically?
Let Gordon start on that and then I can chime in.
Okay, as you know, we've been relying very heavily on expert consultant services to help us lead this project to fruition. And so what we will be looking for in those three positions is people of similar caliber to what we're hiring through our consultants right now. So people who have extensive experience in P3 projects here in the US and elsewhere around the world as well. Okay, and managing those P3 projects and advising the owner on those projects, and in managing the accounting aspects of it, if you will. Okay, and so those are really the three positions that we're looking for right now. Highly experienced in P3 and sort of non-traditional project delivery, if you will.
Yeah, and not just, experience in stadium P3, but experience in other complex P3 projects.
And then, so the 728,000 you guys are estimating, what's the breakdown for the salary for each of those positions plus this, and then versus the startup of the offices?
In this huge binder next to me. Can I get back to you on that? I do have it, it's just gonna take me a little bit of time. In fact, I'll try to get that information to you before we close out this hearing.
Okay. Thank you, and sorry, over.
Yeah, of course.
And then actually, I wanted to see if there was an update from ETS about the project that was allocated last year for the data sharing system, the positions and just setting up the software and everything. Is there any update that you might be able to provide on that?
Yes, thank you, Vice Chair, aloha committee members. So last year there was some funding that was approved, and thank you very much for that, to support the expansion of our data governance and data sharing services. And so we're happy that we actually have those positions. We're waiting for them to be finalized through the system so that we can hire the positions. So we're really looking forward to bringing them on at the start of this year. In addition to that, we actually did get approval to procure the data governance tools just in the last several weeks, and so we look forward to actually really accelerating that work moving forward. Thank you.
Good, looking forward to it. I've been telling people, other departments as I talk to them about maybe their data needs or potential work interdepartmentally, so hopefully they'll
We're
come
really
asking
excited about
you
that.
guys if I, or if you, and you should also advertise to them.
Thank you.
Thank you.
So Vice Chair, actually, I'm sorry, I don't mean to interrupt, but I do have the information for you if you'd like it about those positions. And so maybe Gordon can come back up in case there's additional questions about it. But so for the three positions are as follows. A special project executive, which would be $220,000. I'm just using round numbers here. A senior project manager position, which would be $160,000, and a cost management specialist, which would be $139,000. I do wanna mention that these are exempt positions. These types of positions don't exist within civil service. And so we're looking to create these with an exemption.
Thank you.
Yeah, I just wanna follow up since you're up here. You know, and I appreciate that, you know, the state hospital, you know, it's in the process. And my assumption is that you've been working on this for a while, so an announcement will be done soon, probably state of state, but something like that. And then, similar to the convention center and the state hospital, they have two things in common, right? It was either design flaw or installation or construction or whatever, right? So do you think at some point we need to revisit the limited liability issue as far as what we impose on the A&Es as well as the contractors? And at some point extend it or put it maybe have specific language for extreme circumstances that are, you know, obviously a design flaw. That it should have been right. So my assumption is the convention center is one of them, and right, it was and we went through when we did the walkthrough at the state hospital was obviously design flaws, right, or construction flaws. And that was a design build project, so they're supposed to be working together and work all those out, right, all of that. But are you guys looking into something like that to like you know, help the state in the long run and working with the AG's office, I would assume something like that.
Very much so. Both the convention center and the state hospital were design build. And it was design build, and then the design builder just could walk away, right? And we have to maintain and operate the building after that. One of the I think virtues of the P3 kind of a project is that we tend then to design them as design build maintain. And what we're doing with like for the Aloha Stadium project is design build, operate, maintain. Okay, so there's this long tail.
Yeah, that was the conversation we had last year, right? And I agree with that whole concept. But I'm just wondering, like, there are still projects that may not go through that, and the state should consider changing the law.
I don't disagree with that. I can't provide any guidance at this point on
Well,
that, but certainly
I think,
we are aligned in that thought.
As far as maybe what other states do, you know, to protect themselves in the long run on these kind of things, especially it's not new. It happens in DOE a lot. It happens in other areas besides DAGS, right? So I'm just wondering if that work has started, and if not, then where should we start?
As you might imagine, it has been the subject of a lot of discussion over the last year and a half, 2 years, with regard to the existing issues that we have and trying to look forward about how to better address those issues in the future. It's an active discussion.
Can I continue? Okay, that's good. So and we'll talk later more in detail on that issue. So you converted cash to GEO 10 point something million dollars. Are you gonna consider that for, and I don't know what the breakout is for the Lahaina fire insurance money, it should be geoed, I think, and it should not be a cash project. If you're gonna do Kamehameha 3, it just makes more sense, especially because we need cash. Is that being considered?
I would say that we're looking at all options to properly finance that project, including the use of some federal monies. So whatever the mechanism is that we.
But your plan is to use cash?
It is a combination of the proceeds from the insurance monies that we are
Yeah,
going.
but the insurance money, we have the flexibility to convert.
Sure.
Right? So, and being that we need the cash, is that being discussed?
I can only speak to what I'm aware of as it relates to the discussions that I've been in.
Are you recommending it as a comptroller?
I would say that it would require us to take a deeper look at what the funding makeup would be for that particular project. I will just say this, that if you were to look at any typical brick and mortar project, such as a school, you would typically fund it through general obligation bonds. This particular project is somewhat unique. I mean, it is to replace a school that was destroyed in a tragedy that occurred in West Maui. And so I think that and I don't wanna speak for the administration, but I will just say that the goal here is to get that school rebuilt as quickly as possible. And the funding side of that equation has been one that has been an ongoing discussion now for, a year. Yes. And we're just at a place where we think we have a better idea of what the federal funding picture was gonna look like. I don't have the numbers handy, so I can't kind of share it with you, but it's a combination of federal monies and other proceeds such as insurance funds that would go towards, rebuilding the facility. So I'm happy to have those discussions and I'm open to it. I think at the end of the day, all we really wanna do is get that school rebuilt as quickly as we possibly can for our friends and family in West Maui.
The original $15 million that was appropriated to the convention center for the rooftop, it might have been when you were there at HTA. You don't remember, right? Okay, I'm just trying to figure out, I can't remember going back timing wise, cause I know that money lapsed and why we didn't execute it back then and it might have helped.
I can tell you, just from my, having been there for the short period that I was there, the rooftop issue has been an ongoing issue since the day that convention center opened. So it is something that, has been sort of the thorn in the side, if you will, for an incredibly important asset that the state owns, that we just simply have not been able to fix until now. And I know it's causing a lot of heartburn, but I think at the end of the day, we have to do whatever we possibly can, right, to support bringing the convention center up to the standard that it really needs to be, to attract big conventions that pump a lot of money into the economy. So, but the 15 million, I'm sorry, I don't recall. I could have. I'm sorry, I just don't recall.
Okay, I'm just wondering. Yeah, because right, this issue's been around a while and we're pumping money into it and it's not moving, nothing moving, right? So, and several iterations of what was gonna happen throughout.
So one of the things that I wanted to share that when I was there as the chief administrative officer is I worked closely with the convention center team to develop a 20-year strategic plan for their maintenance, their various CIP projects, and so they have a 20-year plan and they should still have, and they have a 6-year plan that outlines all of the projects that they've got, including what we created was like a briefing document that shows what those projects should be. Whether or not they continued it, I don't know, and I apologize, but that was something that they really embraced, and so I hope that has continued, but Just a lot of projects at that facility.
But okay, I'm sorry, going back a little bit. So there is for the insurance money, there is a plan exactly what you're gonna spend all of it on.
I wouldn't say there's a plan as how we're gonna spend all of it. There is a need to support funding.
So there's no plans to how you're gonna spend that money when it comes out.
There is a need to spend it on the school at this point in time. We don't have any requests before us for things like the library or other state facilities that.
So the plan is to use all of it for the school?
No, I think the school itself is about 146 million is what the
Because
estimate is.
Because I would assume part of it is for the harbor too, right?
It potentially could be, yeah.
I mean, we're capped at 200 billion or something like that, and we only could get so much for it. Okay, I brought this up to can I go? Yeah, thank you. I brought this up to BNF and Carl Bonham when he was here, right? Where we're losing workforce age people at a record number. And the concern is that, right, all the departments, including you, are saying that you're making strides as far as hiring people and things like that. But we know that that demographic is shrinking, right? And that at some point in time, the feds will start hiring again. And at some point in time, tourism will recover. And as we know, they will pay whatever they need to pay to get the workforce they need. So my assumption is, and I didn't ask this of certain departments like Department of Health, but I think your department is one of the ones that may be vulnerable to this kind of shift in workforce. And so the thought was, right, that we know that it may come, probably will come. Is there a plan to figure out how to right size, to figure out what you absolutely need to operate DAGS and what is your nice to have? That's the way I posed it to BNF. And that I believe you need to figure out, right, at some point in time, right, and this is redescribing positions, this is all kind of stuff. We need to adequately, we need a well compensated workforce, but smaller, that can maybe do the job in things like that. So, I think we need to pay more. I think when in '96 when we started reducing the benefit package, right, and 2012 we did it again, but we never did adjust for pay, right? We reduced benefits, but we didn't adjust. So back then we were the employer of choice. People wanted to work for us because there was a great benefit package. Now, right, when we made the shift, we didn't adjust with pay, so we're not necessarily the employer of choice anymore. So, with all those things in mind, I think we gotta start figuring out how we're gonna right size what we have, knowing that it'll shrink.
I agree with you, and here's what I will tell you is that through projects like the Enterprise Financial System project that you have all invested in, we will see a change in the makeup of people that work for our departments in the fiscal side of the operations. And I think it's those individuals who are accountants or doing bookkeeping or doing other fiscal related responsibilities that get scooped up by the private sector, right? When times are good, they're gonna try to get people that have those skill sets and they're gonna take them away from the state. But I believe that with technology as an example, in addition to looking at the positions themselves, we're going to be able to consolidate as people retire and change, modify those roles because we've got new ways of doing business that we're not doing it the old way anymore, we're doing it the new way. And so we may not need certain skills, right? So to your point,
this is something that we did talk about before, so I applaud you for getting in that direction. I think that's where we need to go, but at the same time, right, it may happen sooner than you're able to get it started, so
well, hopefully it's 2 to 3 years we anticipate having EFS online. 5 to 6 years, we anticipate all modules being completed for the enterprise financial system project. So hopefully, as we right size, and these are not just DAGS positions, these are fiscal positions in all departments. As we go through that process, hopefully we can help the departments upskill and find the right positions to be able to take advantage of the modern system that we have that's been implemented, and reduce their reliance on staffing.
One more quick one. Okay, so you said you're increasing charging stations. Is that mainly for our fleet or also for the public?
It's open, some of that is open to the public.
Okay, yeah. So what kind of stations are you building? Are you building fast charging stations depending on the location where they're gonna park there for a short period of time, whether it be a different type of station where they're gonna park there all day? And then with that, are you working with people, whoever, to make sure that we have the energy to be able to?
The answer is yes. So right now, I will just share with you that we're installing level 2 chargers in our parking garages and lots.
Not the level 3 ones yet.
No, and some of those are 50 amp chargers and some of them are 16 amp chargers. So, but in addition to that, we're also looking at ways to enhance the, part of the problem is these garages are old, right? And so the electrical systems need to be upgraded, right? So we have to upgrade the transformer, or we have to do all kinds of other stuff, and that just requires us working with HECO or MECO or wherever it is that we're making these enhancements. And so we try to do what we can at the lowest cost possible to the state. We do have these monies that are sitting in our revolving fund, and we would love to be able to tap into those monies to be able to bring better chargers to our facilities, level 3 chargers as an example. So, but in the meantime, we have to do with what we have, and unfortunately, oftentimes it's I call them slower chargers, but I mean it still do pretty decent.
So strategically, I think my understanding is that the private sector is right, the auto industry is rethinking its rollout of EVs. So that it is not getting market penetration as much as they thought it would, especially with the feds reducing their credit. So going forward, we have time to build out our infrastructure, because I think they're looking at the hybrids as far as an interim form of meeting, getting there. Because I think everybody agrees that EVs is probably the future, probably. I don't know for sure, but probably. And but there are companies, and I won't name them, but they're big, that believe that EV charging, there's money in it to be made. So is that part of your strategy will be self-funded charging stations?
That's our goal, yes.
Alright, thank you.
Thank you. Members, I'll go Rep Liloy and then Rep Alcos, and then I'll come to this side. Go ahead.
Thanks. I'm a little nervous following this entire panel. Like, so steeped in information. I'm gonna start with Rep Down around the charging stations. And I'm really curious about doing induction charging, because I think when it comes to infrastructure and making a parking stall with a pole, when you could create an entire parking area, just like we put our phones on a pad to charge our car, I think that is a way to fall forward. And so just throwing it out there as you explore innovative solutions for the need, I think there's even other areas we could explore. I wanted to focus in on the CMMS maintenance systems. Absolutely excited about that. I think we had a conversation about that a year ago. But I know you mentioned that it was kind of in development. You guys are kind of pushing out the RFPs right now. I was just really curious in addition to it providing like a overall maintenance schedule, on the back end, as we move projects, special projects forward, I was just really curious within the RFP for design build construction, if we could add in design build construction maintenance and operations that could be fed into this system and kind of close the loop on new assets in addition to legacy assets that need the repair and maintenance. I was just curious.
I think the beauty of a modern system, like a modern CMMS system, is that as we build new brick and mortar facilities, all that information, which is, by the way, kept electronically by our consultants, gets imported into the CMMS and literally builds out the schedule in terms of what needs to be fixed when, or what does the preventative maintenance schedule look like for the building. So once we get to that point, I think you're gonna see, it's gonna be, I don't wanna say it never will be seamless, but it's gonna be a lot easier for us to capture and incorporate that data for new facilities. The biggest challenge for us is that all of our facilities, not all, majority of our facilities are old. And so there's a lot of labor that's going into like building the data that's gonna be part of that. And so Jimmy and his team have been working on that through consultants to be able to capture information about our facilities that will be incorporated into that CMMS. And so we're very excited about the opportunity that's gonna be in front of us. And we're looking at dashboards that maybe they could be public facing dashboards, as well as dashboards for legislators to be able to get an idea of sort of what's going on, right? So that you don't have to ping us for information, you can just go on and see it yourselves. I mean, I think that's the beauty of these modern systems, is there's a lot of flexibility that's built into them. And so at the end of the day, we'll have a much better picture of, what is it gonna cost, and not only what is it gonna cost to handle the maintenance for the facilities today, but even rolling out forecasts. How much are we gonna need in year 5 for all of these facilities, right? And what does that look like? How can we afford it, right? Like, what's gonna be, the strategy to do that? Are there things now, and this is where Jimmy's team can come in, are there things that I can do now that pushes that timeline out 10 years instead of 5 years, right? That maybe costs a fraction of what it would cost in year 5. So he's already thinking about that kind of stuff. I mean, he's chomping at the bit to get that system in. And in fact, you probably, I don't know if there's any sensors in this room, but we have been collecting data in various, including environmental data. Environmental data doesn't record any no, it's just purely environmental. So, but we've been collecting environmental data so that we can understand, how our existing systems are functioning, air temperature, humidity, right? Those kind of things that can tell us ahead of time, is the system beginning to fail? Is it not keeping up with demand, right? Is it out of whack, right? All of a sudden, is it like 20 degrees in, well, maybe not 20, okay, 50 degrees. And do we need to send somebody out now to go and take a look at that system, right? We've already started that effort to be able to collect that type of data, so that we can better inform the CMMS when it's ready to launch. So
Yeah.
all of that gets fed in, right?
No, absolutely. I'm absolutely on board. I've been trying for years down at the county level, a needs assessment, when do the warranties run out?
Exactly. All in
Right,
one
our
place.
HVAC systems, like you are singing a song I like to hear. Just building off of that, in addition to something our CIP chair mentioned, which is the state hospital, and I got it, I can read between the lines. But I absolutely support what they're saying. There's a strategy, there's a legal strategy, but I do think there's a lot of valuable lessons to be learned around design build and the idea of construction is sloppy and messy, and oftentimes there's things that change in the field that actually make sense at the time, but in the long run hurt the life expectancy of the overall project. I will leave it right there. I also wanted to walk into some of your fleets. You mentioned the modernization of the fleets and some of the things that you were doing. I was just really curious because I've heard this happen in DOT transportation where they start to outfit their new vehicles with Starlink. And you also mentioned highway, I think, was this idea of allowing for communications when other communications are failing. I was just wondering if that was something that could be filtered into this modernization of the fleet. So Starlink, you're out there, you guys can continue to communicate, or high winds could serve not only state agencies and government response, but the community at large. And we live on a very big island, and so when communication goes down, relying on Starlink, wireless towers is a heavy need. Again, trying to fall forward to have a very robust emergency response at a time when we least expect.
Yeah, I appreciate that, and I will just share that we do have layers. So I do believe we've got Starlink that we're utilizing. We have actually deployed in for various different purposes so that we have that additional layer of coverage.
Yeah.
It's a good suggestion.
And then special projects, absolutely, I think that's excellent idea, but I did wanna walk into the ask regarding the State Building Code Council and that executive director position. Could you help me understand what the expectation is for those two FTE positions? Because I heard you say for your special projects, an executive at 220, a senior planner program manager at 160, and then a cost manager at 139. I'm just trying to be comparable as it relates to the adoption cycles of our building.
So the special projects branch,
Yeah.
which I described, those three positions, we kind of already, talked about that one. But it is really to allow us to be able to handle these more unique, complex projects, right? But the State Building Code Council is an attached agency to DAGS, so I don't directly manage that agency. All I do is all our team does is provide administrative support. I am a non-voting member on that committee, but the purpose is to look at the updates to the various codes, plumbing, electrical, international building code, right? And to figure out what makes the most sense for Hawaii. And then to push that out to the counties for their review, consideration, and adoption. And so there's a whole process. I'm just scratching at the surface of like what SBCC does, but they have not had an executive director or staff. So what has happened is a volunteer state employee, not within DAGS, has taken on that responsibility in addition to his day-to-day work, which has then caused that process to maybe not be as efficient as it possibly could be. And so unfortunately, it makes it somewhat of a delay, right, to get those new codes out to the counties, right, as they're being introduced. So with the adoption, with the support of the executive, which is, as I mentioned, is in statute. We're not making it up, I mean, you can see it, I think it's in 107-23. Thank you. But it does say there shall be an executive and staff. It would help make that process more efficient and get those codes completed in a more timely manner. Because you're not relying on pure volunteers to do everything. So I don't know if Gordon wants to provide some additional insight into that, I welcome him to provide that. But in essence, it's really to really do what the statute has asked us to do as it relates to.
Yeah, and I get to sit to my right and my left of colleagues. We sat on the the SPEAK task force and became very intimately familiar with the family of construction codes and the adoption cycle. And absolutely, I think there is room at the state level for the evaluation and the code cycles as they come through. Because we're hearing from our county building code officials that they're so busy trying to issue permits that to take the time to evaluate the family of construction codes and have it done in a fair way that state projects understand what the expectation is while when they get further tailored down at the county levels. Because we have very unique counties. So back to my question, that executive director position and so it's two FTE positions.
One is the executive and the other is the executive assistant, basically, support staff.
And then curious because having spent some time at the State Building Code Council myself, there was a lot of questions and interpretation around what's nice to have and what's health and safety related. And I was just curious if there was any room for Attorney General or some kind of legal support for that. Just trying to make it fit, trying to make it work. Cause if we do move this forward, we want it to last for a while and address all the hiccups and the lessons learned that over the course of years now.
Yeah, no, I think that's actually a, very interesting and good suggestion. I think in addition to that, and we may be able to get support from the Attorney General's office through a deputy that may have that sort of experience, but I'm wondering too if, and we've talked about it because we were thinking, gosh, what other, to your point, resources would they need to really carry out their function? And we were thinking perhaps an engineer, right, who, has that experience of dealing like practical experience of dealing with the code would be helpful and beneficial, right, to be able to support this and provide guidance. So we wanted to make the request, a humble request and not sort of come in and like you guys be like, oh my gosh, what are you talking about? So to get it started and then perhaps in future fiscal years come in and ask for the additional support staff like what you're describing.
Yeah, and to the point, I mean, we've had a number of conversations, both my colleagues here next to me, about recommendations on how to make this entire system work better. And we've heard from Dr. Bonin that construction has been the pillar of economy that has held the state together since COVID. And we're trying to make it work as efficiently and effectively as possible. I'm only asking because there's some other recommendations about State Building Code Council, DAGS, Office of State Planning, the Governor's Office, putting our heads together to really refine this position, funding, or what other ancillary needs might be advantageous for us to put in now to help carry us through if we're gonna move the building codes process forward to a 6-year cycle or whatever that might look like in the future. I'm just trying to fall for it a little bit in a time when we're seeing a big hole in our budget. Okay. Love to have an offline conversation with you and Gordon. Thank you, Gordon, so much for all your help. I did have one final question, and this had to do with the CIP lists. Our CIP chair for DOE, we kind of lumped it, we were doing lump sum. And I was just really curious about, because this really applies to our neighbor island campuses, where DAGS actually looks at the repair and maintenance of our classrooms and our school facilities, right? So DOE kind of gets the lump sum, but it's driven by DAGS. How either or any one of these new special projects or new state building code council positions or something that we're doing in a lump sum where we can effectively or efficiently effectuate the spend down of the lump sum monies that we have in these DOE for our neighbor island campuses. How do we do that? And it's been clunky, I'm just saying, it's been clunky.
Let me just start by saying that the lump sum that's given to DAGS on an annual basis, we spend it. I don't think there's very much, if any, that is not expended at the end of the day. So I think we're very efficient in the way that we use the monies that you have generously provided to us to be able to do the work that's on our plates. As it relates to the DOE and our neighbor islands, I just wanna say that yes, DAGS does provide some repair and maintenance services to the schools there, the DOE facilities. We don't provide all. There is a service level agreement that dictates what we do and what we don't do on a day-to-day basis. So our carpenters, our plumbers, our electricians, those kind of things, they're going out there and they're doing and resolving work orders. And so there's that aspect of monies that are coming over to us for, like, let's say we gotta buy supplies to replace something, right? Typically the DOE reimburses for that. And maybe even for smaller projects. Where I think there's room for opportunity is really in the larger projects that the DOE puts out to bid and then or needs to put out to bid, let me just say that, right? And our DAGS team typically will help to support the DOE, like in terms of being on the ground, like boots on the ground, to be able to go out and take a look at, what does that project look like? What does it entail? How significant is it? And then also they provide sort of the back end coverage, like when the project is underway. So we have like basically a project management team that will go out and just kind of make sure that the project is on track and on schedule. So that's kind of where we fit into that picture, like from a larger, like the larger DOE lump sum monies that may be given to them for school projects. We play more of a support role. And we will call out projects that we see that we're concerned about. How do we make the DOE more efficient in the use of those funds? I don't know, I mean, that's like $1 million question.
Keep pushing, I think, which walks me back to the CMMS system. If we have a needs assessment and we could actually use that for DOE, because oftentimes there's never enough money to do a roof replacement on a gym, and so they'll just, we'll fix the bathroom. And the big fix never happens because there's not enough priority funding. And then again, the lifespan of that building starts to languish because we don't have enough money and or repair and maintenance didn't happen. Anyway, I think it's a hole in the bucket conversation and I want to plug the hole in the bucket.
Yeah, and I will just say that my discussions with Superintendent Hayashi have been very good, very productive, very supportive. We work very collaboratively with the DOE to help them expend those monies, right? When we see these projects that are within our sort of agreement and our space, they have been there to support us in that effort, to give us the funding that we need. So I think they're trying, I really do. I think they've got a good team now in place with Jesse Suki, who's there sort of leading the effort.
Yeah, Jesse's great.
And so I think you're gonna see a big sort of shift, but he's got a great team that's behind him too. And I'm sure you've met them all, but they're all working really hard to get those projects out. And from a neighbor island perspective, I just wanted to share this with all of you. You supported the creation of a West Hawaii district office. We were able to stand up that office. We've got a new district director that's there. His name is Ramsey Mansour. He came over from the county of Hawaii. We got him to join our team. He is amazing. That man has a wealth of experience. So we now have all 4 district engineer positions filled on the neighbor islands. We haven't had that for a long time. And so, you know, we've got highly skilled people like Eric Agena, who's here from Kauai, Ramsey in West Hawaii. We've got Wade Shimabukuro, who, you know, our Maui contingency probably knows. I mean, Vince Sarkis, I mean, all these guys, they're talented. And so now we get to whittle down these lists and support the DOE in ways that we haven't been able to in the past.
Yeah, and thank you. I
Yeah.
think that's what we're trying to do.
We're excited about it.
It's too expensive to go build a new building. I would rather upkeep and maintain.
Yep.
So they last the 30 years.
Or more,
Or
right.
more. Thank you, I yield.
Members, Rep. Alcos, and then anybody else? Alcos?
Thank you, Director. In Ever Beach, in my district, my area, in the 1962, I was checking online, our population was under 5,000. And right now, today is 8,300 as I look at it. And we continue to grow. We still only get one high school. I know we build a little bit more classrooms and portables after portables that we get out there. And we still feel the stress of a need for more classrooms, more facilities, more infrastructure, more roads, more parks. But we neglect that from the 60s and we're not even getting it yet right now. So my thing is I appreciate some of the trying to build some of these things, trying to catch up with it. But in 96706, we're not talking about Kapolei. I'm not talking about the new school that it's gonna be built in Ho'opili and the new elementary schools that gonna develop there. That is already gonna build and overwhelm in that area, and our community is still growing. And we're gonna be flowing back to Ever Beach again. What is the plans for Ever Beach and how are you gonna help our community to release that stress?
Let me just say that I like your community. I think Ever Beach is a beautiful place.
Since we won the state football championship.
That's right. Congratulations. I also like the fact that you know, that the rail is out there and offers a great opportunity to bring folks in from that side of the island into the central core of Honolulu, right? I think there's an opportunity there. From DAG's perspective, I'll just say that so we don't plan or manage schools, right? But what we do plan and manage are other state facilities that other state offices may rely upon. So I will say that out in Kapolei, right, there's state office facilities out there that we support and we provide services to. I don't know that we have any state facilities in Ever Beach specifically. I'm looking at Jimmy because he would be the one maintaining it. But I would encourage if you're looking at DOE related needs out there, I would encourage you to reach out to Superintendent Hayashi, talk story with him about it, you know, and sit down with his people and kind of see where he's coming from, you know, on that front. Because he's the one, ultimately, it's a DOE call, right? DAGS has nothing to do with that aspect, right? I'm not trying to pass the buck, it's just, we just don't have, that's not our kuleana, it's not our responsibility.
I just was thinking if you had something in mind already in plan, since you have 400 something projects, is there any projects out in Ever?
Oh, I see what you're asking.
You know.
I'd have to go back and take a look at it and see what we've got out in that district. I'm happy to do that and send you a list of what we might have.
Yeah.
But honestly, what happens is departments are asking for like brick and mortar projects and then they get delegated and assigned to DAGS.
Right.
So DAGS isn't the one going, oh yeah, we need a library here, or we need a school there, or we need, you know, whatever, right? Like we basically are the consultants that are leaned on when, you know, somebody has a project. DOE has their own team, so that's a pretty bad example. But let's say the Department of Ag has a project, or the libraries needs our help for a project. You know, they'll lean on us, they'll delegate the monies, and then Gordon and his team will then carry that out, execute and build those. So I'll go back and take a look and see if there's anything on our list, and then I'll get back to you, Representative. Yeah. Appreciate that question.
Representative Kush? Well, and anybody else after? Oh, sorry.
I'll make it fast because we got like 50 people on overtime now. So, and I may have lost it in extensive questions about the CMMS is, will you be able to have that up and running and reportable for the 2027 legislative session? Or is it too hard to tell, prognosticate at this point?
As I mentioned, I think we anticipate procuring a platform in the next, was it 6 to 8 months?
Oh, procurement still.
Yeah,
Okay,
and
okay, sorry.
so, and so then there's actually building it out, right? So I'm not sure exactly what we're gonna have. There'll be something, but I'm not sure how extensive it's gonna be at that point, right, for the biennium you're talking about?
Yeah, no, I didn't realize that you were procuring and you were hoping to have it live in 6 to 8 months, so my apologies. Thank you, and the rest of my question I will email you, thank you.
Thanks, Representative.
Okay, Representative Reyes-Soda.
Hi, thanks for coming. The question I have is when was the last time DAGS built a school?
Last time, 2005, according to our Public Works Division Administrator.
So being that the DOE has facilities department that builds schools, we now have, in the last 5 years or so, SFA to build schools. Do you know why DAGS was chosen to build K-3?
I only know that the governor asked for our assistance with the project, and so we stepped in and provided that assistance.
Okay, thank you.
Great. Members, additional questions? No takers? Okay, well, thank you very much for joining us. I know it's a little bit late in the workday. Just as a brief announcement, tomorrow we are reconvening at 9 a.m. with the newly minted Department of Agriculture and Biosecurity, followed by the Department of Taxation, and in the afternoon at 1 we have the Department of Defense, Department of the Attorney General, Department of Education, Charter School, branch, and we are adjourned for the day. Yeah.